like a professional would. Welcome back to day 2 of the Saam acupuncture tradition introductory course. What I thought we'd focus on today is our format. We'll do one or more of my cases, and then what I'd like is for one of you to present some of your cases. On the live stream, Kate's going to be reaching out to you about how to do that, and what we're going to do is we're going to get a collection of names, anyone who wants to present a case, and Kate's going to put them in a bowl, all your names, and then fish out one. So hopefully you've been saying a whole bunch of nice things to Kate on the live stream, so when her hand reaches in, she grabs your name for that case. Everyone here in person, we're going to be passing out this bowl, and you can write your name on it if you would like to present a case. And then again, we'll have lucky Kate pick out hopefully your name to present your case. So we'll start with one of my cases, then we'll do one of your cases, go back to probably one of mine, and then go back to yours. Depending on our pacing then at that point, what we'd like to do is we'd like to be able to have, treatment too. So then again, unfortunately live stream people, I don't have the technology to treat you, but people here in person will be treating. So then we'll send the bowl around again, and we'll ask for any volunteers, anyone who wants to be treated. And then like I said, we may have time for one or two of those. But to start out this morning, what I'd really like to focus on is if you have any questions about the Saam system that came up over the night. This is the question I have for you is: do you feel like you're getting enough information to be able to practice this tradition first thing Monday morning? So anything that I can help you with to kind of clarify, anything that's unclear, if I can make that clear. Or something that's just like a little hazy, if I can help make that a little bit clearer, that's what I'd like to take this morning to do. So if anyone has anything they would like to bring up that came up in the night, Kate's getting tea, so why don't anybody here, anything that they like? Yes, Anita, go ahead. Oh, wait for the microphone.
Good morning.
Good morning.
I was thinking about the kidney excess, because in the school we didn't speak about kidney excess, and when that accumulation of the water and the worm get together and stagnate, does it mean that
it's consolidate? Stagnate sounds bad. Consolidate is what it happens, and that's just physiological. It's consolidating.
Consolidate. And so it can create the fibroids, right? That consolidate.
Yes, then it can lead to stagnation. Consolidation can lead to stagnation, but healthy consolidation, there's no fibroids. It's just consolidated well energy. Over consolidation leads to the fibroids.
And what causing that over consolidation? Is it that fears what is connected to the kidneys, or what lifestyles is?
For the Saam system, what organ system is associated with fear?
In Saam? It's not kidney, right?
No, it's not kidney for the system. Like someone asked the other day about anger. For Chinese medicine, we often talk about anger associated with the liver. For this system, we think it's very close for the gallbladder, the wood one for gallbladder. But what about fear? Sometimes people talk about kidney associated with fear, but for this system, which one do we think about for fear?
The gallbladder, then?
No, for fear.
Fear.
Orly, do you remember?
Can you repeat the question?
Which organ system in Saam system is associated with fear?
The urinary bladder.
Yeah. Right. So it's close. Again, bladder and kidney and liver and gallbladder. So it's close. But for this system, like we were talking about before, everyone when they get again, we were talking about being scared, and then the urinary bladder system gets cold, just like we predict with the Saam system, and then you get really terrified. You urinate yourself when you get really afraid. So this, we experience this in our lives. It's not just from a book. That's a common known thing, right? You so terrified you pee your pants.
And then when I would decided to give the Liu Wei Di Huang herbs, do I increasing that excess because? Is it like a connected with that?
It's hard to know for sure exactly what happens, but if you're putting fire and water, I'd say more like Jingui Shenqiwan, so Fuzi and Rogui plus Liu Wei, the original formula. If you put that together, that's more like kidney. right? The original formula. Later on, then they cleaved off Rogui and Fuzi and made Liuwei Huang. But the original formula is fire and water together. So I think Jingui Shenqi is similar to supplementing kidney with the points.
So even when I said that excess, so we still supplementing with the herb formula kind of similar way, like how we supplementing through the points, like we let the supplement and little bit drain.
Oh yeah, like Jingui Shenqi Wan has that, right? Has that little bit of draining damp to make sure. I think it's really similar. But like, say for example, our patient we saw yesterday, the 12-year-old girl. Do you remember the case? Yes. Would you give her Jingui Shenqi Wan?
No.
Would you give her small intestine?
Yes. Thank you.
So yeah, it fits. It fits.
Thank you.
Mm-hmm. That's a great question. Thanks, Anita. Anybody else in person have any questions that they'd like to clarify about the system? Great.
So for the lung and the spleen, when in excess have an ascending function, so they're older balancing organ systems have a descending.
Exactly.
Is one of those stronger than the other, like in the way of like cool and cold, or
Not really.
Not really, okay.
I mean, yeah, I think not really. My sense, just from clinical experience, I think stomach might descend slightly stronger, but I think it's really close.
okay, and I forgot there was some mention of like hardness under the subcostal region and associated with which organs, right?
It's really valuable. Stephanie, would you mind palpating my abdomen?
So you'd like me to palpate your abdomen?
If you're up for it. First thing in the morning, Sunday morning. Hold on one sec. This would be better if I was laying down.
Yeah.
But if you can just start at the...
Okay. So
How's that feel?
there's some firmness in there.
Do you find anything very
There's
unusual?
a sunken, yeah.
But what
let's
about,
see.
do you find anything especially that shouldn't be there?
Something that shouldn't be there.
How long have you been practicing?
Oh, I think about 12 years.
Yeah, I can feel it. She's got eyes on the ends of her fingers.
Oh,
I can
do a
feel
lot
it
of
penetrating. This is
touch,
great.
yeah.
No, it's great. Here, I'll help you find it because you're. That's not supposed to be there.
Oh, this, yes. So I
Yeah.
guess I would expect a rib. Yeah.
Yeah. So that's tight, firm under the left abdomen.
And then
Do you remember what that has to do with?
here.
That
Oh, yeah,
one's,
this
that's
is,
a
this
much
is-
softer.
This is, yeah, this is softer.
So theoretically, if you felt this kind of abdomen, you would consider Sanjo access for this type because
Okay.
so tight and firm, and even some weird gummy, sticky things in there, and this side nice and soft. So if this side was tight, then you'd think that you might want to supplement the lung. This side, you might want to supplement the liver because the liver's generated life on the left and something on the right, the lung. Okay, yeah, great.
Thank you, yeah.
Thanks for good palpation.
I have, I don't know, one more that is sort of,
Okay, great, yeah.
I was sort of thinking more that, like, maybe you already alluded to this. I think you have sort of excess in one organ. Can it swing, like sort of yawn
Sure.
going? Yeah, I
Sure.
don't know. I was thinking things like the
But not
guardedness
usually.
of the liver and the sanjiao, that there's a tendency to, for those qualities in the same person to kind of, or at least in me, maybe to,
Yeah, but you know,
sort of
acute
swing
things can
back.
happen. What about, say, like I was saying before, female patients more UB excess? What about when they have a high fever?
oh, then heart.
Yeah, so that's a swing, right? They're constitutionally UB excess, but then in acute situations, so then they go hard excess.
But something like hot flashes is more. Something like hot flashes was not possibly that, or just
Yeah, hot
depends.
flash is something too. So anyways, you could be, that's what I was saying before about the menopause thing. Do you remember what I talked about yesterday? So a female's mostly UB excess until menopause, then they go hard excess, and then they adopt everything.
Okay, thank you.
Great clarifying questions. Orly had a question, if you don't mind passing the microphone.
I was just curious about spleen ascending when it's in excess, because I was under the impression that we want it to ascend naturally.
Yes, healthy function. Then let's say the spleen and large intestine are healthy, so totally balanced. Then ascending and descending is perfect. right? If the spleen becomes excess, then we can see that burping, vomiting, nausea, everything like that. If it becomes deficient, what do we see?
Sinking.
Yeah, diarrhea or something.
Okay. Thank you.
Uh-huh. Great. Any more questions here in person? Okay. Anything on the live stream? Oh, can we pass the microphone to Kate?
Okay, a couple of questions from the live stream. Let me start with the chat here. Yesterday, we talked about the shoe points, so there's a request to go over how to use the shoe points for back pain.
It's such an important point of that. Again, I practiced for years without having that concept, and I was always struggling so much. So anything that there's any kind of problem with the shoe points, what you want to do, any shoe point, like say for example, like we were saying, what's the shoe point for the liver? UB 17, 18?
18.
Okay, so there's a problem at UB18. It basically doesn't matter what the problem is. There's a problem at UB18. Could be pain, rash, cluster of moles, something like that. There's something going on at UB18. At that point, as a Saam practitioner, you don't know if you're going to supplement Sanjiao or liver. You need more information. Let's say, for example, they have really bright eyes, then you'd supplement liver. If they have really dull eyes, the exact same pain at the exact same spot, then you would supplement Sanjiao to deal with that. So all the shoe points have that correlation for the Saam system.
Yeah, and thank you, and I believe Carmela has a question as well.
Uh-huh.
So I'm going to unmute her,
Great.
and we just want to confirm fear is the emotion for the UB, and so does that mean that narcissism?
When the UB organ system's in excess, then fear manifests. We should say really clearly, when the UB organ system is in excess, then fear manifests inappropriately. When UB organ system is correct and everything's balanced out between the heart and the UB, what happens is there's something to be afraid of. Godzilla comes and you're like, oh, and then you run. That's exactly perfect. That's not UB excess. That's exactly the right thing to do. Godzilla comes over the horizon. You should have fear and run. But I'm saying when you're afraid of everything all the time, that's UB excess. Or then also, what's the guy that does the climbing, the free solo climbing? Alec Honnold. Alec Honnold, right, has heart excess and UB deficiency because he's not afraid of climbing up Half Dome. So that's insufficient. Everyone should be afraid to climb Half Dome without any ropes. Even with ropes, people should be a little afraid of that. So Alex Honnold has bladder deficiency, we could say for sure. And then someone who's just afraid all the time, oh, this branch might fall down, oh, that kind of thing, that's UB excess.
Would that make kidney excess narcissism then?
Yeah, that's what we were saying before about, I thought that just came to me at the time, right? We were thinking about the heart excess menopausal women that were looking through the window to adopt the puppies and kittens and everything. They want to go and scoop them all up. And the kidney excess person would look through that same window, all the animals in the cage, and they'd look through the same, but they wouldn't see any of the cages. They'd be looking at the reflection in the mirror. Right, that would be kidney excess, right? Animals in cages, there's no heart, there's no love going outward. It's all inward, so it's all my reflection. This one sometimes extends a little bit to this kidney excess, right? Myself, my clothing, my children even, my connections, things like that, right? So it's all about, an extreme level when it's unbalanced, narcissism.
Okay, great. Carmela, if you could unmute yourself now, it's a great time for your question.
Thank you. Good morning.
Hey, good morning, Camilla.
So I have a few. How in Saam voice and hearing is working. I will share with you a very short story of a client. Her son died from overdose. She came to see me the first time. She said, I cannot close my eyes. I am in a fear. She didn't use the word fear. She said, I hate closing my eyes.
Carmela, pause right there. I'm ready to diagnose and treat her.
I did liver and she was very happy. But then the second time she came, I did pericardium. She was not very happy.
I don't think
And
that's the right
now-
diagnosis.
What?
I don't think that's the right diagnosis. I've already treated her successfully in my mind.
You're right. So she said, I'm not sleeping. And I thought, oh, pericardium will make her sleep. Then she's not happy. But now she's giving me another challenge.
Okay.
And the challenge is, I don't want to be in the room alone. And I said, I can put some music for you. No, I don't want to listen to music anymore in my life. What is this mean in Saam for me?
Can I ask you 2 counter questions?
Yes, please.
What channel is associated that the primary channel goes to the eye, associated with fear? Now the third question, and is associated with hypofunctioning.
Hypofunctioning is the UB.
Yes. So UB goes to the eye. So she has a hypofunctioning there, and
Okay.
she's terrified of being alone and terrified of being with the music. So I'm ready to treat her successfully right now. What would I do?
Tell me. This is why
you and I
this is
diagnosed the same
weekend.
thing. What would we do if you had that diagnosis? What would we do?
Okay, sorry again. So I didn't understand. You say I'm ready to treat. I'm sorry, I didn't understand it.
My needle finger is getting itchy. I'm thinking about your
Okay,
case
so
so
tell
much.
me. Okay, so what is the question, please?
Okay, so what are you going to do? What are we going to do based on our diagnosis we just made?
That she doesn't want to be in the room alone,
She's afraid. She can't close her eyes.
right?
So that's a hypofunctioning of her body. You should be able to function there. Again, this blinking all the time, that's hyperfunctioning of the eyes, right? She has a hypofunctioning of the eyes.
Okay.
And that happens to have a primary channel that goes right to the eye.
Which is UB, you said to me now.
Yes. So which channel which 4 points should we look at our card and use to supplement?
Okay, so the heart points, of course.
That's what I want to do.
Okay, so heart. But heart will make her not to be willing to hear now music again?
Yes.
Yes?
I
Because I'm
guarantee it.
opening the heart.
I guarantee it that she won't be afraid of music after you put those 4 points in.
Thank you. Now, okay, what about voice? Because I have clients
Divorce?
with some, how do I relate some and voice?
Tell me what the problem with, we got to move on a little bit. So tell me what the problem with the voice is, and I will give you the answer.
Okay,
Leslie
some
will give you
voice
the
are
answer.
very loud,
Oh no, she hasn't.
sometimes are very raspy.
Okay, all right, stop for a second with the loud. Are you ready?
Kind of like think about shouting in a way.
Yes. Do you remember the thunder and lightning image we saw the other day? Where it's a
Yes.
boom voice.
Okay.
What's that associated with?
Sanjal, then you
Gallbladder.
no gallbladder. Okay.
The thunder, gallbladder.
Yes, of course. Okay, gallbladder.
So that can be a loud booming voice. Also, the lung excess tends to have a loud voice because they have so much resources. Oh, they have a loud voice. Okay. So
Okay.
we got the loud part. Raspy. That's a good question. We didn't discover that yet. Raspy voice can be associated with kidney.
Okay.
Do you know who Tom Waits is?
No,
Okay.
I'm not sure.
Okay. When on break, I would
Yeah.
like you to listen to a Tom Waits song.
Tom Waits.
Are you ready?
How do we spell his last name? Waits.
Like you're waiting for something with an S.
Okay.
Okay, you ready for the song? What was the first one we did this morning? Oh, Make It Rain.
Make it rain.
You got that?
Yes.
And this is my archetype for a raspy voice.
Okay.
Okay.
And the one more question about Sam. I have clients.
Oh,
with
wait, I
missing-
didn't answer your raspy voice question.
Okay, sorry.
So that's a kidney excess voice.
Okay.
Husky,
Okay.
husky, raspy. That's kidney excess.
Okay. Husky. Okay.
Okay. Do
Can
you
I
have any
ask-
more questions?
Yes, missing limbs. I have a
What?
client with missing limb, large intestine,
Missing limb?
missing. How some deal with people who have amputated leg or finger missing in their toes or
Yeah.
hands.
You have to use the other side. If all the limbs are missing arms, is your client missing arms and both legs?
Yeah.
Then
No. I
Oh.
have some that are missing some. It's a some of them are legs
Yeah.
that are really dangerous to put needles in my point of view because they have cellulitis and I'm very afraid to put any needles in them.
For sure. For me, I needle into cellulitis all the time.
Do?
But if
Okay.
you don't want to, that's a safe thing to do. So then, yeah, you should not put needles into cellulitis if that's if you don't feel comfortable about that.
Okay, and so just do the other side if they're missing limb.
That's my recommendation.
Okay, and if I don't put in the leg, so I do just the 2 needles of the arm, the hand, and that's it, 2 sides.
You better wait till you do when you do the advanced classes. I
Okay.
talk about that using just the arms and just the legs. Sometimes even just
Okay.
one point. But so at this stage, you better not use the Saam system for that.
Okay, already. Thank you so much.
You're welcome. Any more questions?
No, I think for right now you answer my
Oh,
question.
great. Kevin has such a good setup. I can actually see you.
Hi.
Hey. Okay, great. Thanks, Kevin. Okay, any more questions or anything in here or anything more in the chat? Okay, great. So we're going to do our next case. While we're doing our next case, I'm going to pass this around. Billy, if you want to present a case, you can just write your name on that and then write your name in that jar. And then, like I said, Lucky Kate will pick out hopefully your name from there. If you don't want to present a case, you don't have to, but it's an option for you. And then, Kate, the same for the live stream people. Okay, while we're working on that, let's look at our first case then. Okay, again, I would really like you to feel like this is your case. Giselle, I want you to feel like this is your case. This is your 17-year-old male that just came in your clinic. So I want you to take it like super serious. You can take notes if you want. You can just memorize it. I try not to do any notes when I'm with the patient. I try to just memorize everything, whatever your style is, but I want you to really feel like this is your patient. So you don't have to look at your notes again that I already gave you, right? Just do whatever notes you have now or just listen or something like that. So it's really like your patient, okay? Here's your 17-year-old male patient. Can I have that microphone, please? To Leslie. Leslie, let's look at this case together, okay? Okay. So our patient just came in, 17-year-old male. The C, again, is just to remind me who this is. His pulse was very thin and weak bilaterally. Already catching your attention, right, Leslie?
Yes.
17-year-old male,
Should not
weak
be
and
that
thin
thin.
bilaterally. Wow.
No.
Okay. I didn't look
Be
at
that
his
weak.
tongue. Sometimes I don't look at the tongue. I stopped, with masks and everything, I stopped looking at the tongue, and then sometimes I don't look at it anymore. So this particular case, I didn't look at his tongue. His face was ashen and pale. He had some really good symmetry. Remember, we were talking about that before, right? He had some good attractiveness with the symmetry. He had slightly dry skin when I palpated it, and he had acne on his face. Body type, extremely lean. I don't use the word extremely kind of casually here. He was extremely lean, like almost skeletal. And then when I checked his body, the overall on his body, his skin was slightly moist. Do you have any questions about that?
Yeah, so the acne, is that oily acne? Is it red? Is it pussy? What's
Yeah,
it like?
it was.
Or blue,
No, it was pussy, like pustules and things like that. His face was like slightly dry, but it definitely had like oily spots in coming up.
Okay.
Anything else about this?
No, so far so good.
Okay. Leslie, you're representing the whole class, so
Oh my God.
no pressure. Okay, so his abdomen was tight on the left and the right hypochondriac region. Like Stephanie came and palpated in here, I was just left. He was left and right, both really tight. This midline, like we were talking about before, that was warm and tight for him. Okay.
Yeah.
So that was my abdominal findings. Do you mind reading this?
His chief complaint was inflammatory bowel disease for the last 4 years, no known trigger, poor appetite, sweet cravings, weight loss, diarrhea up to 12 times a day, abdominal cramping 24/7, but very intense several times a day. Yeah.
When you're a 17-year-old boy, I know you never were, Leslie, but
Well,
I was a
not recently.
17-year-old boy in high school. The last thing you want to do is run out of class
To the bathroom.
several times a day.
Yeah.
So he's really not doing very well. And just to put added pressure on us, he has a dance coming up that he really wants to go
Oh.
to. I think we'll talk about this.
Well, thank goodness he's symmetrical.
Yes, he's got he was symmetrical enough to get a date, but now he's worried about leaving his date on the dance floor when he runs off.
Every few minutes.
Leslie, I've warned the other students.
It's just compassion.
I've warned the other students,
not
and you're a senior student in this tradition, so you know that I like to make the jokes and crack everybody up, and I don't like you getting in my action. Okay. All right. So, how as a senior student? Oh, everyone, when you have a chance to, you should seek out Leslie on the break. She's got a great story about it, Saam when she was in India. Okay. So, knowing a lot about the Saam system, why do I say no known trigger here? Why would I say no known trigger?
Because if you know what's causing something, that is very good information. It would take you to a diagnosis. But if you don't know what's causing anything, then you're going to go by the data that you do have, which is primarily his body type at this point.
Exactly. We love in the Saam system to look at the Bingji, the disease trigger, right?
Yes.
What happened with this? He just, it just came on, or maybe something happened, he just couldn't report it or something like that. But I always like to explore that because I like to know what factors happened when this first started, and then that gives us a clue what's going on. Otherwise, like you're saying, we have no known trigger, and then we have to just focus on what we see right now.
Okay. So respiratory frequent coughs, easily catches cold and asthma. The energy is a deep fatigue. He has difficulty staying asleep, and he has acne on his face and back.
Right, he showed me this too, face in the back. Same type of thing, pustules.
Okay. Oh. All right, he's on prednisone, Humira, which is not controlling. These things are not controlling the condition. He has concerns about increased infections.
That's cancer.
Cancer risk. Oh, yeah.
Humira it knocks down your immune system so that you have
Yeah.
all cancers, your rate goes up. Is that good?
Generally not. No, especially if it's not controlling the
so
condition.
it's not doing the condition. And
Yeah.
I don't like prednisone either, too. So this is double whammy. This is why his mom sent him, right? Because
Yes.
she read the fine print on the Humira and was like,
Oh, my goodness.
not for my son, thank you.
Yes. So when he has headaches, the whole head, and muscle weakness, and the calprotectin score.
I didn't know what this was. I had to look it up.
Is this a inflammatory marker or something?
Yes, it is an inflammatory marker, and it's 1,200 micrograms per milligram. Normal is 50 to 200. So
He's very inflamed.
So we can say that, his body is not functioning. But we already knew that with our Saam diagnosis. We don't need blood work to come back,
yeah,
right?
but it's kind of an interesting combination because he's super, super dry.
Right.
And then he's got this inflammation, which is often some kind of swelling, and that would imply some dampness somewhere.
Only if we had a sophisticated system that could manage
If only.
damp and dryness at the same time.
If you know that kind of thing.
Yeah, that'd be
Yeah,
great.
can you
That'd
point
be
me in
great
that
to apply it for
direction?
this kind of case, right? And then also,
would.
right, I picked cases that were just clean, straightforward for you guys and everything like that. So that's right. This is bias on my side, and we're just using, like I was telling you before, about 60% of the time I do these just single 4-point combinations, but then other things I do some fancy things. So I try not to include any of those in here,
Right.
so we can do this. So, but I saw them really recently, maybe just a couple months ago. Okay. Any questions about this this page, Leslie, representing the whole class?
Yep.
Okay, you're ready to diagnose, Leslie, or do you have any
You
questions?
know, I am thinking I'm ready to diagnose.
Great. Can you check with the live stream and see if they're ready to diagnose, if they have any questions about this case? Otherwise, we're ready to break out into breakout rooms. Giselle, come up here and sit with Sharon. Orly, come up here and sit with Leslie. Colleen, can you come up and sit with Billy? Bring your chair. And Sarah, can you flip around to sit with Stephanie? And Shauna, do you mind going back and sitting with Lindsay? Maybe bring your chair over there. And then can you go with Dennis, please? Just you can just flip around. He's right there. This isn't one of my teacher's temples in Korea. This is the. Oh, damn, I forgot exactly what it's like. The ultimate gate or something like that. He was at this temple, Tongdosa. The name of the temple was Reach Enlightenment Temple. So it was great to meet. This one I got to meditate at 4 a.m. in there, and they have a relic of the Buddha, one of his teeth in there. Oh my goodness. So this was built 600 or 700 years ago. So all the wood on the ground is all from all that chanting and bowing. It's all worn down. It's really amazing.
I don't want to block your view with it. Should I just step back here?
Yeah, no, come around.
Come around?
Yeah.
Hi.
Yeah. Or early, you can come around here so then you can look face to face, or if you're comfortable there. Sorry, I had it in my mind, Giselle, right? But I didn't articulate it. I was like, yeah, just come in and flip around. Because look at this. You guys have nice.
So we're doing a conference style.
Yeah, you're like conference style.
I'm Giselle. You're just, yes, okay. All right, hi, I'm Sharon.
If you guys forget, just look at the roses. That's what I do. Okay, hey, welcome back, everybody. I hope you had a good discussion. Can we get the microphone to Dennis, please? Oh, yes.
All right.
And it says you had a question, I heard.
Yeah, thanks. So, one question I have is the word dampness. In the trying to be a little more accurate with that, because
Great.
When I think of dampness, I'm always thinking pathology. And are you using dampness?
What percent of the body is damp, according to Western medicine?
70%.
I think that's right. Yeah, something like that. So that's not pathology, right?
Right.
Okay.
So I would call that fluids, but you would call that dampness. Is that correct?
I don't differentiate them with the Saam system.
You don't differentiate.
Because look, let me do with my hands. Large intestine and spleen. This is pathology. This is fluids.
Mm-hmm. I agree. Okay. All right. That helps. And so if we're looking at these relationships in the counterbalance of spleen and large intestine and then stomach and lung, we see this balancing act between dryness and dampness. And when you have in your little cliff notes thing here that, say for example, we have the spleen with inner dampness and outer dampness.
Yes.
What you're referring to there, is that actually the symptoms as it's expressing, meaning the pathological excess dampness that you just gestured at? Is that what we're looking at there then?
Yes, that's the qualities of that channel. It will manifest with pathology if it comes out of balance. Mm-hmm. If it becomes excess relative to the other one, mm-hmm. then you'll see these qualities. If it's perfect, then we have that 70% water that we need.
Right. So if they're having very oily skin and they're having internal dampness.
700 pounds overweight.
Okay. So then that would be a spleen excess.
Yes, correct. That would be extreme. It'd be easy to diagnose that, right?
Yeah, right.
700 pound oily skin and 700 pounds overweight. Then we like I was doing with that other case, your needle finger gets itchy, you're like, oh, I know exactly what to do here.
Right, okay. So in my beginner's mind here, I would take that in my, am I correct in my treatment being to supplement the large intestine? Bring it up. Is this correct?
100%, yeah.
All right. Phew.
What's the slowest pathology to respond?
Dampness.
It's just this is the one that keeps you up at night, right? Because it's so sticky and recalcitrant, right? We just have to. Billy and I saw a case. I was just really easy rash case. Treated him once, not really. Treated him a second time, not really. Third time, I supplement large intestine. Just like exactly the exact points that you guys learned. I did exactly those points for Billy and I's case, and then it just gone. Not all the way gone, but a huge significant change. He sent me a picture, and it was like same, significantly better.
So in your clinical...
All the heat was out, which was interesting. I tried to deal with the heat first. What did we do for the second time? Do you remember?
It was on the channel.
Oh, liver. Yeah. So I tried to do with the heat with UB, and then it was basically Sanjiao channel. So then I tried liver. No. And then I'm like, it's the freaking dampness. Took supplement large intestine, and then released everything there. I was trying to deal with the things that were being stuck, and then unstuck them, and then bam.
So would you say that in your clinical experience with the qualities of dampness as potential pathologies, that the Tai Yin, Yang Ming, Earth Metal pathologies are more stubborn to treat than, all things being equal, than some of these other?
100%. And so I just thought of another funny story about my teacher, okay? So my teacher, I believe, was the first time he came. So he was going to be seeing patients with me in America. I was so proud, right? Coming to Cloverdale, my teacher's coming all the way from Korea. He's a wandering monk, so he's everywhere. He goes everywhere. He could just show up, right? I always kind of got to corner my out because this is what he does, right? He just shows up. So hopefully, right? But we'll see. Anyway, so he comes and we're on the way to the clinic, and he's like, okay, I just need to get to know these American patients. I'm like, okay, yeah, you will. I've got everything lined up. You know, they know my teacher's coming, so everyone's so excited. He's like, no, I need to really know them. I'm like, okay, just pull over here. Okay. We go into a convenience store. He gets one of those super drinks, sweet drinks, and goes, sucks it all the way down. He goes, I understand America now. So there's just damp. There's too much damp here. So that's what I do all the time. So he feels like in America, spleen excess, and what's the other excess that he felt like we were all about? Do we sleep well in this nation? Are we a little aggressive with our military and things like that? So he felt like we were spleen excess, gallbladder excess. And so there was a lot of pericardium, a lot of large intestine going on here.
Can I ask a question regarding that point?
Dennis, you're so, as a fellow teacher, I could feel you're just so conscious of everyone's time. I think that's fantastic. Please ask your question. I think that was great. I think everyone, Anita, that was a good question, right? So I think everyone would really benefit from another good question, Dennis.
So along those lines of gallbladder aggression, what I see clinically, particularly on the heels of the pandemic, are a lot of people that are constantly second-guessing themselves, afraid to put one step forward.
That's fear, though, Dennis. That's fear.
It's okay. Okay.
I think I put that more in fear. The gallbladder excess is more. Oh, were you thinking pericardium excess, or?
Well, I think if I can step out of some, again, my tendencies like to default to, right?
Yeah, but
so I see a lack of gallbladder chi.
Let's bring all your clinical experience into the system. This system's so sturdy. It's such a sturdy framework. You could just pull it all in there. Okay. I have like Sharon Weisemom, 45 years experience or something like that. She just pours all that into the system. She finds it very sturdy. So I think for you too.
Okay. Yeah.
Tell me your question.
Well, I just see a lot of people who seem to have a disconnect between the wood and the fire elements, and so they may have all the tools. And
tell me their symptoms, because otherwise I think we're going to go off track.
People that are overly cautious and don't trust themselves to manifest what their desires are, to take action into not just in their own lives, but out into their families, into their communities.
That could be pericardium excess.
Pause there, lack of courage.
That could be, it could be pericardium excess.
Mm-hmm. Okay.
Yeah, I think this pandemic made a lot of people go in, right? That was my sense, right? And now everyone's like really that ability to expand and go back out. I think people that like kind of atrophied. So yeah, that we would say, yeah, the pericardium has become excess to gallbladder though. So that's unusual, and not everybody in America already.
That makes great sense.
Just
actually.
90%.
I see that. Thanks.
Yeah, yeah. So great question. Anybody else? Oh yeah, go Lindsay. Oh, wait for the microphone.
Just to kind of follow up on Dennis's question there about dampness and spleen. Since I feel like, spleen deficiency is talked about a lot, at least more from like a TCM perspective, so I'm still trying to clarify kind of the difference here. How do we reconcile like this concept in my mind of like what you're describing of Americans, being over sugared and, like tending to
It's
be a little
150
bit
pounds
heavier
of sugar per year. I think it's really close to that. I mean,
that's huge.
It's like disgusting.
Yeah. So that, but then at least it's kind of described this way, at least in like the TCM education schools, we're also all suffering from like spleen deficiency from excess work. We're just like exhausted. So what's that kind of considered? So that is that like also another excess spleen? I always thought it was a spleen deficiency pattern, being like we've worked too far, we have no energy anymore. But is that just we're overthinking, and so it's an excess as well?
It tends to be the body type would really guide us there. But there is in the Saam system, there is a channel that's best for supplementing qi. Is that what you're getting at, or were you asking me something else?
Well, I guess it's more of like as we're trying to identify like this excess to know the counterbalance pair. To me, that would be like a contradicting kind of not sure whether it's excess, not sure whether it's deficiency, not sure whether to treat the large intestine, not sure whether to treat the spleen.
Are they fat or skinny? Then you could decide.
Okay. And then based off of that, you decide
because it's earth metal phase, that the physicality is going to be most important for our diagnosis.
Okay.
So fat and skinny, that's an easy way to say. Exhausted fat person, large intestine. Exhausted skinny person, our case, right?
Okay.
Spleen would be better.
Thanks. Should I maybe ask the other two questions we talked about? Okay.
I was trying to...
So one was about the diarrhea, and I think it's kind of related.
Yeah.
And then the spleen
that
we talked about.
Exactly. That's exactly. So in general, for diarrhea, we think of it as a wet problem.
Yeah.
But for a really skinny person with dry skin with diarrhea, you should really consider spleen.
Okay.
Right, because it's a wet problem, but the constitution's so
supplementing
dry.
The spleen.
So thank you.
Okay.
Do you need anything, Lindsay? Or do you already have everything? You got pole position for app 3.
Another book. I have friends.
Okay. Who do you want this one to?
Oh, you have a different book?
But this is so great.
Oh, well, how many?
Orly, okay. Hey, Lindsay, that was so great though because you corrected me and then used my preferred translation for boo. So that's the book. Thanks.
Following up on that,
Hold on.
also, I think it's relevant.
I'm a male, so I can only do one thing at a time.
Okay. Supplementing the spleen rather than like draining it.
Thanks so much.
You told me to ask what the first 4 points were that the Wandering Monk treated for you, and I feel like maybe this is relevant to
that's perfect. That's really on topic for us, so that's great. So how far do you want the story to go back? You want to just talk about just the diarrhea or what caused the diarrhea?
Sorry, I got distracted. I
sorry.
apologize.
I was asking you, do you want to just talk about the diarrhea or what caused the diarrhea?
Oh, in this case specifically?
Yeah, I know this patient well.
Okay. Oh yeah. Oh yeah. In your case, that.
Yeah, but do you want to just talk about the diarrhea or what caused it? Like
both.
You want
Both
the
would be
BG
interesting.
or the? Okay.
Yeah.
So I graduated from an undergraduate degree, and my degree was in food science, and so I immediately got my dream job, making ice cream, and so basically I just made. Do you know what Trader Joe's is? Mm-hmm. So anytime I made ice cream flavor, it was Double Rainbow in San Francisco. Sharon, are you a fan?
I used to work with them too.
No.
Oh.
When?
Way back in the 80s.
This is me in the 90s. So I was developing new flavors for Sharon and I's former career in the ice cream field. So you know Michael and Stephen? Oh, okay, awesome. Awesome. I knew we had a connection. What shop did you work at?
I used to run all the company stores. And I was quite
You were down in
20.
South Van Ness? In the headquarters?
I ran all
That's
the
I worked in the
stores.
lab down below. What's your favorite flavor?
Mint chocolate chip.
Okay,
So
I reformulated that. and it got better. Got better.
Why would you do
Got
that?
better. Because I'm a food scientist. We can't just leave things as they are. Okay. All right. So that's a great connection. Did you ever have the Nutcracker Suite, SUITE, that I made for the San Francisco Ballet? Nutcracker Suite. It was lovely. Okay. I think we're getting off topic here. Okay. Lindsay, what were we talking about?
Are you talking about diarrhea? And
Yes,
then-
thank you.
Getting
Lindsay,
really sick.
I like to make the jokes, okay? We're talking about an important case. Okay, so I was working at Sharon's business, her first job. I also had a job there coming out of school. So I was paid really well, and then anytime I made a new flavor for Trader Joe's, I got a huge bonus. I'm living 6 blocks away with my good friend from high school. We've got a great apartment in the city. I've got a cute girlfriend. I've got just nothing but time. I have no responsibilities, no kid. I just have everything that's going on. And then San Francisco at that time, late 90s, right? All the big bands were coming through. I saw Smashing Pumpkins in a small gym. They were getting ready for their world tour, and they played a small gym. I was just a few feet away from them. All this, just so much music and things like this. So, and my commute is, I have no car, so I'm just biking back and forth. It's just great. Lindsay, am I happy?
Well, it depends.
No, but that seems like a pretty good setup, right? Everything I ever wanted as somebody in your young 20s, money, girlfriend, great, my job is to eat ice cream all day,
Yeah.
music, tons of parties, a lot of experiences, Am I happy, Lindsay?
Well,
who wouldn't be happy with that situation?
It depends. Yeah, it depends on how.
Right.
Yeah.
I had no concept of the inside at that point, Lindsay. So everything.
So maybe not.
Everything,
I'm implying. Or I'm getting
everything on the
impression.
outside was everything I
not.
can think of. I think I would have been able to blame my unhappiness on something like, say I didn't have a girlfriend, or say my job sucked, or something like that.
Yeah.
But I had deep unhappiness, and I couldn't tweak anything. I couldn't take the dial up anything more on the outside. So this was very, very confusing to me. And so I would turn to my friends and say, hey, I'm not doing good. I feel worse all the time. And they said, let's go to another party tonight. I'm like, I felt worse after the last time. I was like, no, this is going to be great. So-and-so is going to be there. Sublime, do you know that group? So we knew them. We had backstage when the lead singer OD'd. He was in San Francisco, and we were there. So we had just all these great, crazy things happen, all these great things. We'd go hang out with Sublime. I didn't care. I felt worse hanging out with Sublime. So, anyways, so I thought to myself, okay, what am I going to do? I feel so lost. The only thing I could think of was to go get lost on the outside. That's the only thing. I had money and everything like that, so I just left everything. I left my great job, girlfriend, apartment, everything. I just left. And I'd traveled to Europe before, and I met some people that were traveling through Europe to Asia. And I thought, well, that sounds kind of cool. And so that was it. I just took some money with me. I thought, okay, I've got enough to travel for 2 months. And then, I just don't know what I'm going to do. So that 2-month journey, about a year into it, that's when I met my teacher, the monk. At that time, for that year, it doesn't changing your scene, because wherever you go, there your insides go. So I'd be like at Everest Base Camp and be like, oh, the Taj Mahal. There's the 3-colored lakes of Indonesia. And it just, nothing was working. So I just kept wandering around. So then eventually my teacher, out of compassion, came to me and helped me. So at that point, I was skeletal with dry skin and diarrhea. And so when my teacher came in contact with me, and I'm just so ignorant, right? I just don't know what's happening to me there. So we travel together for a few weeks, and he sees me running to the bathroom all the time, a little bit like this case. And I say, he's saying, I've got these acupuncture needles with me. I'd like to help you. And I said, I'm fine. Right? Here I'm just horrible inside. It was just so disconnected with everything. So I was like, I'm fine. He's like, So anyways, it went on for a few weeks, and he's like, I'd really like to help you. My grandfather's a medical doctor. My undergraduate degree was food science, so I knew these little needles with no medicine in them, it's not going to do anything for me. Finally, he's so nice. His compassion is, he's got his vibrations are amazing to be around. So finally I thought, he's such a nice man. This will make him feel better. I'll lay down, put these 4 points in. What 4 points did he put in, Lindsay?
I'm guessing it might have been either spleen or lung.
I think it was spleen. At this point, I didn't really understand acupuncture at all, but I'm pretty sure it was spleen.
So
and then, so I got up from that meal, and got up from that treatment and had a meal and 3 desserts, something I hadn't been able to do for months. So then, what happened to my mind, Lindsay?
You immediately were converted.
No. I was like, that's amazing what he could do. And then we traveled together for a little bit further. He was going to Dharamsala, and I didn't want to go. There was a real popular thing to do, so I didn't want to go. So I went to Pakistan, and then I met him later. Anyways, a whole bunch. But so then we ended up traveling separately, and then about 9 months later after that, I was like, I wonder if I could do that. And then immediately came home, enrolled in school, immediately. Because I was like, oh my God, that was amazing what you do. And then I got to Chinese medical school, and we went to clinic, and first day in clinic, so I'm watching this, and our student, our teacher, it was 4 observers and the teacher, and the teacher is saying to the patient, okay, so this is your 23rd treatment for that shoulder pain. How's it going? And he's like, I don't know. I don't think much has happened with that. And he's still in so much pain and everything like that. And I was like, what the hell is happening at this school? So then, and then my teacher came back and trained me some more and things like that. So that's the long diarrhea story.
So the 4 points would have been the spleen, supplement the spleen.
I'm pretty sure spleen, but again, I wasn't quite sure that he put some needles in my hands and feet. But I didn't really understand.
Yeah.
I didn't understand anything at that point, so I never asked him specifically, but I'm pretty sure that was spleen. That's what I would have treated myself with, and so I think that's what he did. Okay, thanks for asking me that. Shauna, I think you have a question?
Toby, so just to clarify, for the chat in the Zoom, the skinny body with diarrhea, that is large intestine excess?
Especially if there's dry skin. Skinny body and dry skin, that's dry on the inside and dry on the outside. Right? Thank you. Okay. Shauna, you had a question?
I do, but just sticking with this for a minute. So the diarrhea, is that considered any form of dampness?
It can be, but what I'm saying is sometimes you have to double damp. You have to supplement the spleen to deal with that diarrhea. Mm-hmm. So that's a little bit, but I mean the body type is really what guides me there. But if they're medium, say they're medium wet and medium, like totally balanced, wet and dry, then I would supplement large intestine because the pathology itself is wet.
So the kind of, I guess I'm going to use the
word. I got another thing too. What if you determine that everything's like prolapsed and sunken for a normal body type? What would you do?
Well, I would want to lift. As one of the lifting options.
So maybe spleen.
Spleen is our typical one that we use, and it lifts in Saam.
So that might be good.
Okay. So, sorry. So for that situation where somebody would have a lot of with prolapse and sinking, you would choose. My first thought, anyway, is to think about the 2 lifting organs, which is tai yin, and in this case, spleen is accurate for both TCM and Saam. But you'd also mentioned something about fatigue, and I was just wondering if you could say how we address fatigue.
That's such a good thing to talk about, right? So for this Saam system, if we have just Qi deficiency, that's the only thing we know about the patient, then we should consider supplementing the lung for that case. Because like we were discussing on my discussion with my group and I, that the resources, lung is going to help the patient with the resources. And resources, we were talking a lot about money, but really we should say Qi, so it's resources in general. I have one patient who is never worked in her life, as far as I know, always had like little boutique or a little something going on. And so she's never made her own money. But you know what she's got, Anita? Just tons of rich friends that are always like, oh, what about this? You want to go on my private jet and everything like this? So she's lung excess, but not from her hard. This is even better, right? Not from her hard work, which, you know, if you have hard work and you don't get any resources, that's more stomach excess. But she's just coming to her and she's got all these connections and she's really pleasant, charming and everything like that. So everyone always wants to take her everywhere and do everything for her. And so that's, you know, we have to be careful. Yeah, resources can mean, you know, I imagine she doesn't have too much in her bank account because she just has little boutiques and makes little knick-knacky kind of things. But she's got so many resources, she's always going private jet to France for something. Yeah.
Yeah, for you. When you say.
Oh, well, can you say it in the microphone so that students can hear?
When you say prolapse treat spleen, does that mean supplement spleen?
Oh, that's
Yes?
good. Yeah.
I'm getting a little confused.
Yeah, this is exactly what I always like to do too. So supplement the spleen is going to make ascending qualities in the body. So if we have a prolapse problem, we do want to supplement the spleen to make that ascending qualities come up in the body. Yeah, that's really key. I really appreciate you saying that because that's key.
Okay, thank you.
Billy, does this say? I'm sorry, Billy. Does this say heaven to gate? Or not heaven. It says something to gate. Can you? This monitor is better. I don't know what it is. I forget, but it's some kind of special gate that is in my teacher's temple. Yes. Oh, could you have the microphone, please?
It says it's the big number 1 gate.
Okay, the big number 1 gate to enlightenment. I think is pointing to enlightenment, right?
Big number 1.
Oh, it's big. It's big. Oh, okay.
Yeah.
Okay.
So to that case, also when I look on the patient and has the muscle weakness and the cough and asthma, can I connect it as a lung dryness?
Yeah, because of the body type, yes. You can see that this case is really fitting well into the Saam system, right? Because it's a wet, dry pollen plus cough, easy colds, asthma, right? It's kind of perfect. You know, again, the body type is the most important, but also since it's affecting the lung itself, this is really good for us, right?
Thank you.
Can you pass to Stephanie?
Is it large intestine dry inside and outside, or is it dry outside and damp inside?
What did your group decide?
I think we went down the dry outside, damp inside.
Damp inside for this case?
Yeah, I think that's what we.
He is skeletal.
Okay.
So there's not an ounce of fluid in him. Like Dennis and I were talking about, supposedly 70% water or whatever but he's at like 50% or something. You know, I mean, he's really skeletal.
On the other hand, maybe we said moist skin, like maybe we tried damp on the outside
Do you
because
remember what his face looks like?
yeah, ashen pale. What else? Oh, some acne.
But what else?
What's that?
Slightly dry.
Symmetrical, pale, dry skin.
Slightly dry, right? So there is some dryness on the outside too, because that face is so dry. So the body itself is dry, and the skin, the surface of the body is presenting with some wet and some dry, with the acne and the dry. So that's a little bit more nuanced than we're used to for the Saam system, but we can handle that, right? For the Saam system, we might have to take 2 different channels to deal with that.
Okay, and it's despite diarrhea, which could be dampness or something, or lung.
Most likely, if it's diarrhea and we don't know anything, the spleen and large intestine are equal, then we prefer to supplement large intestine because that's damp pathology, right?
Because it's yeah.
Okay, so we prefer that. What about constipation? Totally normal body, not especially wet on the inside or dry on the inside, and not especially wet or dry on the outside. What would you like to do
we
for
would want to
constipation?
descend. Let's see.
No, that doesn't match perfectly for that. If it's a you decide it's an ascending problem, then yeah, this might not be a good one to do. But let's say there's no ascending, is only normal with constipation. Do we have the saying in Chinese medicine? It's nice to float the boat.
I think you lost me.
I'm saying that constipation, sometimes we need to float the boat, and so spleen would float that boat. What? Yeah, that's what I mean, float the boat. It's a Chinese medical saying.
Add water, yeah.
So spleen, by supplementing the spleen, would do that. It would moisten the too dry large intestine, which is we decided that's the cause of the constipation. Just real quick, Leslie has a question, then we'll go to you, Orly. Orly, I'm eager to hear what your group name is.
I just have a comment that sometimes if something is too dry, it can't absorb any moisture, and you might see the moisture running through there.
Oh yeah, that's a good.
So that's the way I think of diarrhea with large intestine excess.
That's a great. I mean, again, like we've been talking about all yesterday, the macrocosm, and then we can take those same concepts and put it in the microcosm of the body, right? That's exactly perfect. That's been my experience. I've seen that outside so many times too. Exactly what Leslie just said. So that's great. Okay, Orly, you had a question? Oh, wait for the microphone.
So how would you then approach someone who has constipation and like a damp presenting body?
How would you do it?
I don't know.
I might supplement large intestine, especially if the body type is really gross. Let's make it really gross. 700 pounds overweight, dripping oily skin with acne all over them. And they have constipation.
But then, so you're adding more dryness, and how's that helping the constipation?
Can you back the microphone to Leslie?
Wait, I want to share my group name.
What's that? Oh, here, Leslie can say it here.
Okay. So if everything is too wet and sticky, that stool's not going anywhere. When you dry it out, then it has the potential to move. Plus you give them some more chi, so they have something to push with.
No applause.
Toby won't get the
Okay,
applause.
do you want any? Do you already have all these things?
I don't have your Chinese character app.
Okay, give to Kate. Kate, Leslie's going to get a Chinese character out for that. And then Kate gets demoted for all that clapping. Okay, Orly, go ahead.
Saamalies.
That's great. So combining the wine country with the Saam thing. Okay. Usually monastic traditions we don't drink, but I'll allow it because of the location. That's good. Okay, good. Great. That is. I'll say that next time for the class when I say really well done names. That's one. Okay. Anybody else? Oh yeah. Go ahead, Anita. Wait for the microphone.
We can read asymmetry in the face.
How can we see symmetry?
Like you're talking about symmetry in the face.
Mm-hmm.
So
Do you know who Angelina Jolie is?
Yes.
Does she have a symmetrical face or not symmetrical face?
Yes, symmetric.
Do you know what's another asymmetrical famous person? Oh, what's the guy that we always do that was in Reservoir Dogs? Mr. Pink. Mr. Pink, Reservoir Dogs. Males know this? Yes. Steve Buscemi. Is he symmetrical or not symmetrical?
I didn't know him, but yes.
Hey, can you pull him up on your phone and show her Steve Buscemi? Okay.
And when I see that asymmetry, what does it tell me? Like when, for example, nose is asymmetry or the eye are asymmetry. How
is my nose symmetrical or asymmetrical?
Symmetrical?
Asymmetrical. Going to the left. This means I'm more introverted. Going to the left side of the body. Okay. So, and then also, what about the proportion? Nose to the rest of my face.
Long.
too big, right? So the proportion, the symmetry that decides attractive or not attractive. Billy, what was my name in China that everybody called me? I thought it would be Gao Run, tall person. I thought for sure it would be. Nope. You know what it was, Billy?
I don't want to say.
Dabi.
That's terrible.
What is that?
Big nose. They were like, oh, there's big nose.
Wait, most white people they call it Dabi.
Okay, all right. Well, this one it was appropriate.
Dabi is a specific one.
And what's the ghost one? Kualo? No.
Waigui.
Waigui, yeah, Waigui. Also Waigui, because. Okay, thanks, Billy. I mean, how do you say dog fart again? Go pee? No. We bumped up to the limit of my Chinese. Okay. Okay, Nina, do you want to say, does that make sense? So Angelina Jolie is kidney excess. How many children does Angelina Jolie have? Yes, and even got some other ones. It was in Cambodia or something. It was like, I'll take this one too, right? Mine, narcissism. Because that face is really symmetrical, if you look at it. She also has the concubine eyebrows. Do you know this one? The ones that go up like this. They call concubine eyebrows. It's very attractive. Men just can't resist that eyebrow like that. So, good. Brad Pitt, you know who Brad Pitt is? Super symmetrical, hairline, everything's so symmetrical. So then remember they together and they made a whole bunch of kids.
Eye asymmetric, like on the one.
Yeah, again, any part of the face, it has to be all symmetrical. So the eyes, one big eye, one small eye, that's not pleasing. Very same-sized eyes, too wide, too narrow, all those kind of things. Everyone, we think, it's beauty's in the eye of the beholder, but everyone agrees when they look at Angelina Jolie, attractive, and when they look at Steve Buscemi, not attractive. Everyone feels that same way because of symmetry. Symmetry is very attractive. That's like a flower, so attractive to us because that beautiful symmetry. If some petals start coming off, we feel like, oh, it's not right.
And is it mirroring like a eye like a mirroring the liver or like a UV channel, or can we go with that?
You can use those classical associations like liver having to do with the eyes, especially the primary channel goes there, ears with the kidney. You can use those, sure.
Mm-hmm. Thank you.
Mm-hmm. Okay, great. Was there something in the chat, Kate? Okay, great. Let's. Leslie and I are eager to see how we did on our case, so let's move on with that. Oh, you know what? Before we move on to that, let's capture you guys' things. You already have that the whiteboard for the live stream people, Kate? Okay, let's capture that now. Or ask them for it, and then let's capture everybody here. Let's get a whiteboard up, and we'll capture everybody. So Orly Sommeliers, tell me. I'll remember it, and I'll tell Kate in a second. Your guys' top 3 ideas. Go ahead, Orly. Did you guys spend all your time on the name, and then?
Sommeliers was us because we were paired yesterday.
Oh, okay. So that's a carryover. That's a carryover name. Did you use it again? Were you with Leslie? Leslie, what was it?
Someday he'll dance.
Someday he'll dance. I don't understand it.
He wanted to go to a dance.
Oh, someday he'll dance. Excellent. I thought you said he'll, and then I was really confused. Okay, he will dance. Okay, great. Someday he will dance. Does anyone have a microphone near them? Okay, here, pass to Leslie, and then if you can tell me your 3 things. Great team name, and then tell me your 3 things, please.
So we were looking at the acne as some moisture on the outside, and we would start with tonifying the lung on the left. And then if that took care of that dryness, we would follow up by tonifying the spleen. On the left. And then if, the other thing we saw was that he had some insomnia, and depending on if he still had the acne coming out, we could consider the PC. We didn't talk about if his eyes were bright or not, representing the whole class. I forgot to ask these very important questions. But, he had a little maybe shortness of breath with the asthma and some insomnia possible. We would consider PC as our third.
Okay, great. Thank you. Anyone else with a great team name? Anybody else have a great team name? Sarah, did you guys have a great team name?
We had Wind Blossom.
Oh, I like Wind. I like Wind Blossom. I thought it was pretty. Wind Blossom was really good. Okay, wind is really a good theme for our class. There's a lot of wind in the class. Okay. If you don't mind telling me your channel you'd like to supplement for the kids.
We picked to supplement. We diagnosed stomach excess with lung deficiency.
So perfect. Just to make it clean for everybody, just tell me what channel you want to supplement in this side.
Okay. Lung supplement.
What side?
Oh, on the left.
Okay. How come?
Because he's a man.
Yes, but what's even more important? Sorry,
I don't know.
Remember which side we put the lung on?
Lungs on the left.
So that's
Okay.
our top
Liver's
reason.
on the right.
Yeah, right.
Okay.
Right. So that's our top reason.
Okay.
And so that just happens to match for this. But just remember that. So contralateral, we don't have anything, diarrhea's in the middle, right? So we don't have anything contralateral to consider. Male is, gender is our third consideration. What about if this exact case and you wanted to supplement liver, what side would you put it on?
Right.
Yeah, exactly, right? And then even though he's a male, we put liver on the right because it's 1 contralateral, 2 liver and lung, and 3 gender.
Okay.
Okay.
Thanks.
Yeah, but it's nice that then you don't have to think about, in clinic, you just 1, 2, 3, okay. Okay, good. And then do you have a third one?
We said supplement Sanjiao.
What was your argument for
Maybe
supplement?
he had a gallbladder excess.
You would supplement PC if you thought he had a gallbladder excess.
Okay, sorry. PC.
Okay.
Sorry,
So-
Stephanie wrote them down. She was gone.
Okay, good. Okay, yeah, no problem, yeah. Okay, thank you. Anita, did you have a good team name?
So we had a team in yesterday, and we were together yesterday, but today I was with
Dennis?
Dennis. We didn't make the name.
This is your top job when you go into that is team name. If that takes all 15 minutes to come up with the name, so be it.
But,
Okay, but it's got to be a good name.
Something wind, huh? You had a wind yesterday as well? No? What was
It's fine to recycle good names from yesterday if they're good. What's the same famous bridge in the capital of the Czech Republic is?
Karlov Most.
Yes, it's so great. My friend did a painting of it and gave it to me. So
yes,
I spent some time with that
artist.
friend, and so yeah, I really love visiting. And that bridge, something special about that bridge.
Yes, but from 14th century,
Yeah.
and they using for the putting together one of those ingredients was eggs.
Was what? Wow. Okay. Anyway,
And
it
it's
doesn't
here.
smell anymore because 14th century.
Yes.
Okay. Did you guys have anything else besides these? Look, everyone's having the same experience. Supplement lung, liver, PC.
We were thinking about the supplement large intestine
Oh,
as
large
a
intestine.
first. For the diarrhea.
Yes, but are you reconsidering it after we had our discussion with Lindsay?
Yes.
He's skeletal like I was, right? So I think large intestine. You're right, the pathology is wet, but the body type is.
Dryness, yeah. We were thinking like at the second do that the dryness, but like with
He's
that
so
phase,
skinny.
yeah,
He's not going to get wet suddenly.
Mhm.
Again, wet is it's hard to get rid of, but hard to bring back too.
Right. And the third one, we thought about that worm in the center,
Mhm.
what is with the pericardium, with heart, pardon,
Right.
connected.
So what would you like to supplement for that case then?
Stomach.
But it's in the center. He's warm, soft center,
Mhm.
and you want to supplement stomach. Oh, we don't have it anymore. But I think when I palpated his abdomen, was warm and soft in the center. Does anybody remember?
Warm and tight.
Oh, warm and tight,
Uh-huh.
but only on one side, right?
Middle.
Both sides. I remember now. Yeah, both sides. Okay.
Oh, both sides.
So it's both sides. Then you consider supplement liver or stomach, right?
Liver or stomach. Okay. So then we will supplement liver or centroid. Supplement liver. No, I'm a little confused, but then.
Okay.
It's a tight.
Did you write down your 3 ideas?
Dennis said them.
Dennis, tell me what the 3 ideas were.
Yeah, one was supplement large intestine.
Yeah, but so that's wrong now, right?
Yeah, right.
Okay. Yeah, but I appreciate you saying it because I think it's great. I kind of thought about this case and I thought, oh, this is great because it's a dry body but wet problems. Okay, good.
And then second one was lung.
Great. 100% I'm with you.
Okay. Then if we got 100%, we don't need to go any further, right?
Oh, okay, but if I remember I had to see this. Remember the calprotectin score on this guy, right? So I had to see it more than once. So so you supplement large intestine. His face went completely pale, and you were like, oh, that's not right. And then you supplement spleen, and he did good. So far you supplement spleen, partially supplement large intestine, but corrected it right away. So you went to spleen, and then spleen, lung. I love it. And what's your third idea?
It was spleen.
But no, because your first idea was large intestine, but on that same treatment, you took that out on one side and put spleen in the other. So that you did excellent for first treatment. And then second treatment, you supplemented lung, which is excellent. And now you're seeing him for the third time. This calprotectin score doesn't move quickly, although, Leslie, in this case, it did. We moved this pretty quick.
I don't think we had a third one down.
Okay, that's fair. I mean, this is I was saying to my group before. This is why I do this. This is what I do in my clinic, right? I see the patients for the first time. I write down at least 3 ideas that I want to treat, because later on, sometimes it's helpful. You kind of forget about the case, and you come back to those 3 ideas. So every time I see a patient, I think, okay, what's the 3? And then put them in order like that. Sometimes I just write them down and then reorder them later. That's fine. But you want to have like your top idea. You want to do that first time, second idea, third idea. Okay, what else? What should we do next, Leslie?
Let's find out what you did.
Okay, let's see what we did. Oh, what about the live stream? Kate, did we get their answers? How's David doing with his group name, please?
Well, the group name is Saam Like It Hot.
Okay, that's excellent. That's good. That's well done.
And if I'm reading this correctly, and just raise your hand if this is incorrect, and we'll modify. But so I have 3 different groups. And Saam Like It Hot, Jennifer, David were supplement lung, was their first choice, and followed by supplement pericardium. And I don't believe that there's a third.
Okay, yeah, the third one tends to be more difficult, right? Usually 1 or 2 come quick, and then the third one is you got to fish a little bit, so that's reasonable. Side, thank you, Kevin.
Yeah, let me know what side. I think on the left, but let's see if anyone wants to type in.
Okay.
Carmela has a hand raised. I'm going to say what I saw in the chat, and then you can correct me, Carmela, if you'd like. Supplement stomach, followed by supplement small intestine.
So those are both wrong, Carmela, and you'll know why. If I hadn't actually seen this patient and we were just speculating about it, it's possible those are totally right, Carmela, but since I did see this patient and put needles into this patient, like I said, we're never certain about anything until we actually treat. So I did treat. I did supplement lung and spleen. I'm pretty sure that makes sense. We'll look at the case in a second, but I think I did those both successfully. So I would say those both are the incorrect things to supplement.
We have another suggestion here from another participant is to supplement the spleen.
Great.
Followed by supplementing the stomach.
Okay, yeah, so again, I'm pretty sure I supplement the lung in this case. We'll see. And the nice thing is, Kate, thanks so much for moderating this, Tim. I'll say to the camera so you guys know that, yeah, this is the great time to make any errors. This is the perfect time to, here we are in the morning of the second day. This is where I want you guys to make errors. And so that you just lock this in to use the system. I think probably Carmela, and maybe for this case too, you flip it. You flip the diagnosis to the treatment. So that's a little bit dangerous because then you're going to look at your card and you're going to put the diagnosis in and not the quality. So remember, like we did, I think Lindsay did this for the qualities. This is her first of 7 books she got by saying that's the quality on your card. So when you see someone like skeletal like that, definitely you don't want to dry on the inside. You want to 100% moisten on the inside. So
I believe Carmela has a comment about that, so I'm going to unmute.
Okay.
Hold on. Stay close, Carmela. Okay, Carmela, you can unmute yourself.
Yeah, about the small intestine, I really truly brought it up. This was not my first choice, but there are a few things there that are making me to think about small intestine. And they are, one, how do I relate to the symmetry as a kidney axis?
Mm-hmm.
2, we have 2 sides of the body, which is the 2 sides of the hypochondriac region are in tight. How do I relate to this?
You would supplement the stomach and the liver for that second part.
Okay.
And the first part is, do you want to make dynamic movement on someone that has to go to the bathroom all the time?
No.
Okay, me neither. So
Okay.
you're right, the symmetry is there, but the...
So I didn't make it as a first choice. How do I relate to the headaches? And how do I relate to weakness of the muscles?
Weakness of the muscles, I think he's not...
Muscles and old head pain. How do I relate to this one?
Right.
I don't.
Okay, yeah, but like I was saying, if you want to supplement qi in the system, the number one thing we want to do is supplement lung. So that'd be great. If you see weakness and the body types like this, then supplementing lung is a really good idea, right?
Okay.
Okay.
Yeah, and the headache just will be better later.
I forget what happens with this case, to tell you the truth. We're going to find out together what I did. But yeah,
Okay.
if the headache doesn't improve, what channel would you consider supplementing to deal with that headache? It's the whole head, right? I didn't tell you the...
Right.
But is there one channel in Chinese medicine that especially covers, it zigzags the head a little bit?
Yes, gallbladder.
Yes. And do you remember what his sleep quality is like?
Yeah, I wrote in my chat about pericardium, so I did see pericardium as an option.
Okay.
Definitely.
You and I are on the same exact page then.
Okay, great. Okay, thank you. I have more question about the small intestine, but maybe later.
Okay.
If it's okay to ask this question about how do we relate the small intestine, because my understanding is not always kidney excess exists when you are using small intestine. So
you're making an error. There has to be kidney excess if you're going to supplement the small intestine. There has to be.
Okay. I'm sorry, but for my class, the other things is that there was so much use of the small intestine and I couldn't see any excess of the kidney that made sure. But okay.
I make that noise to myself all the time in clinic.
Yes, I do make the noise.
Yeah, me too. Me too. Okay, thanks, Carmela. Okay. What are we going to do, Shauna? Okay, so we got everything. Does anybody here in person or live stream have any kind of curveball things that's not up here? No? Okay, great. We're all on the right page then. Let's take an 8-minute break, and then we'll come back here and we will see what happened with our case. And then we're going to, actually Kevin will come back and we'll watch a commercial, and then we will come back and do our case, okay? Everyone, 8-minute break, please. Okay, everybody, welcome back. I hope you guys had a really nice break. I just have an announcement for the in-person people. I just have an announcement for the in-person people. In-person people. I was able to get some of the cat hair off the t-shirts, so if anybody would like to get into the, again, we have probably extra small and extra large, if anybody is interested in that. So, okay, before we get back to our discussion, Anita, hey, we're back to talking now. There was a Super Bowl commercial that it didn't get enough funding. Dennis, how much does it cost to make a Super Bowl ad?
$2 million.
Yes, so this one came a little short of its $2 million goal. So it wasn't in the last Super Bowl. I'm hoping between now and next Super Bowl it will be in there. This is advertising from Big Pharma with the F. Okay. Suffer from alternating fever as well as chills. Do you experience a sensation of fullness in your hypochondriac region as well as your chest? Have you noticed a bitter, unpleasant taste in your mouth? Have you been plagued with bouts of dizziness? Then you may be experiencing the half interior, half exterior Shaoyang stage of the 6 stages of disease. Ask your practitioner of traditional East Asian medicine if Xiao Chai Hu Tong, the 1800-year-old Changhong Moon formula, is right for you. Side effects of Xiao Chai Hu Tong include, but are not limited to, a sense of overall wellness, as well as sensations of peace and ease throughout your entire body. Ask your practitioner about Xiao Chai Hu Tong today. Yeah, one more time, Kevin. Okay, so let's go with our case, Leslie. Okay, Leslie. So we did pretty well along right with the class, right? We thought let's supplement lung on the left. Immediate abdominal pain less. Well, I think we didn't focus too much on that. I mean, he's got this bad stomach pain several times a day, right? That it's really excruciating. So while he's on the table, I had him checking with his abdominal pain. He's like, oh, less right away. The headache on the table also was relieved. And okay, so this is later on, but he stopped taking Mira on his own. This is, again, not my advice, but I think pressure from the mom and doing good. He had a normal bowel movement for 5 days. Leslie, that's not bad for just 4 points, right?
Not bad at all.
I thought it would be a good case to share because this is pretty successful. So we haven't got to the dance part yet, but that's coming. Can you explain that to me? Oh yeah, can you get the microphone? And then, Colleen, can you hold the microphone for her as she uses 2 hands to show me why this helped with the headache. Use 2 hands and show me how this helped with the headache.
Okay, so my guess is that you were talking about the lung being like supplementing resources.
Yes.
So then, because we talked about the lung, it's moving
Pause just there for a
upwards.
second. Can you pause there just for a second? What was his pulses like?
Weak and thin.
Is that resource for a 17-year-old male? Or that's
No,
pretty significant, right?
not.
So definitely this guy does not have enough qi resources in his body.
Okay.
And so as we supplement the lung, what happened to the other 11 channels? Use your hands to make it. Put your thumb and your index finger together, make a big circle.
There we go. Yep.
And so as we supplement the lung on that big circle that all the channels make, what happened to
They're also supplemented. Okay.
So what happened to his pericardium? Remember, he's not sleeping well?
Yep.
And he has those headaches. So
it's already
as
helping
we
us.
supplement lung, it came around and helped the deficient pericardium. And that happened on the table, which sometimes happens with younger patients,
Yep.
right, that just have got so much good constitutional energy
Okay.
that just happens.
So we didn't even need to treat the pericardium.
Great, right? Well, we may need to, I'm not sure, but at that moment we
At
didn't.
that moment.
So this is another way of saying lung was a great call because, look, it's already supplementing other things. That was the biggest gap in his body. Again, we have the 12 things. Whatever the lowest one were, we thought was lung. I think we were right because it definitely helped with the lung right away to help the stomach pain get relieved right away. And in addition to that, even the headache's getting better. And then what about bowel movement, normal bowel movement for 5 days? You remember what his bowels were like?
They were really loose.
Really loose, and he had to keep running to the bathroom. So this is pretty good. We just put 4 little pieces of metal, put it in his body. What side did we put it on?
The left.
And what's the double reason why we did that?
Because because for males, we treat the left-hand side of the body, and then also because of all of the.
What side of the body does, according to the Suen, where's life generated?
The lung is on the right.
Yeah.
Right, and so we're treating on the left because
we do everything contralateral. Yeah.
Okay. Yeah.
Perfect. Okay, great. So does that answer your question?
Yes.
Good.
Yep. Thanks.
Okay, great. Leslie, let's see what we did a second time, right? He's traveling from far away, so I think this is, just 1 week later he was able to come, but he's really far away, so he was able to come. And then just like you guys, right? Can you read this? Oh, we don't have the thing. Can you read this for them?
Yes, spleen on the left. So now the skin is slightly dry. No, normal skin to slightly dry. So spleen, tonified spleen on the left. And he immediately had relief with the abdominal pain and normal BMs.
Great. So right, that's great. Again, we took our top idea and we did our second idea. Why don't we just keep doing lung, Dennis? Can Dennis have a microphone, please? Why don't we just keep stopping lung? Why did we switch around? And do you do any cycling?
Do I do any cycling?
Mm-hmm.
Minimal.
Okay. But why don't we just keep doing lung, and then have something from the world of cycling? Does anyone a cyclist that takes care of their own bike? Yeah? Okay, you'll answer this then, Lindsay. Okay, Dennis, why don't we just do lung, and then if you don't know, hand the microphone to Lindsay, please.
Well, my answer would be because he's changing. There's
Yes.
a lot of significant.
He's not super fat again,
right?
Suddenly, and so lung is still good, and lung works so good the first time.
Mm-hmm.
Why don't we just keep doing lung? Hand the microphone to Lindsay.
I'm not sure I do enough bike mechanics to have the right.
Lindsay, in your experience, when you maintain your bike, do you ever true your wheels?
Yeah.
Okay. When you true your wheels on your bicycle, you spin it around with a stand, and it shows you the truing mechanism. Right? You spin around.
I know you. I've always just done by eye, but yes.
Okay, by eye is even better. Great. Okay. So just by eye, you can see that it's off a little bit.
Yep.
So once you figure out it's off, do you go to one nipple and tighten it all the way down the weakest one?
No.
Why don't you do that, Lindsay?
Because it will throw the ones next to it off.
Yes, it will, right? Because you just keep, but you want to start with a little bit of that, and then go to another one, and then do another one, and then come around. Because otherwise, if you just go to that one and just, even though it's the loosest nipple, you just crank it, it's going to pull the whole wheel out. So this analogy works. This happened to me in the class a while ago. I have very little experience doing that myself too, but I remember thinking like, oh, I'll just tighten down this one, the weakest one, and do that. But the body's just like that too. You can't just crank on the same one. So for Saam, for my clinical heuristic,
that's bicycle spokes, by the way, for on a wheel, right?
Nipples, right? They call nipples.
Yeah, you're right. It's a nipple on the spoke.
If
anybody doesn't know what a nipple is on a bike,
I think everyone's pretty educated on what nipples are.
I'm before, but.
All right. Anyway, so what's our point there? Oh yeah. So for my clinical heuristic, I'll share with you is I like to supplement a channel once and then try and go to something else. If I don't have another good second idea, I'll supplement it twice. So in this case, we had a good second idea with spleen, right? It's so obvious. But let's say we didn't. So I'd supplement lung once, twice, and I'm really looking to find something else. If I still don't find something, maybe once in a blue moon I'll supplement 3 times in a row, and then you just try to never do that 4 times in a row because you're just really cranking on it. So once is ideal, twice is okay, 3 you're really getting into trouble, and then try not to go past that. Even though it's the weakest thing. try and get something else. That's why it's really helpful to generate the 3 channels that you want to do, because then you can switch around to some different things. Is that heuristic clear? Again, it's just a heuristic, so you can do, like I did an edge case class. I supplemented 1 channel approximately 40 times in a row. But that's an edge case. That's I've never done that before. I probably will never do that again. The exact same channel, maybe 40 times in a row.
40 times? Which channel?
I'm not going to talk about it in this class, but I'm just saying, so that's an extreme edge case. So we almost never do that. So this is the heuristic, but again, it's a heuristic, so you can break that out if you have to, several decades into your clinical experience. Don't keep limiting to that, because if I'd done that for this case, I never would have been able to cure this patient. Okay, great. Let's go on with our case, okay? So this is great. So we supplement lung and spleen, and everything's going pretty good. I forget where the dance comes in on this. Oh, so we see him 1 week later, it's a little bit different, right? Now his body skin is moist and sweaty, so I supplement lung on the left. Again, this is fine to do, like Lindsay does with her bike. Tire with spokes. What's better than nipples? With the nipples. With the nipples, right? So she just. Okay. So, anyways, she does her tire thing, and then but she went lung and then spleen and back to lung. So this is great. I forget where the dance is coming in. Maybe the dance I don't have written here. I'm sorry, I forgot about this. But anyway, so this is good. So we went lung, spleen, lung. That's fine to do. And then response between 2 and 3. Okay, so this is really significant, right? I was so eager for future research into Chinese medicine because we can use Western diagnostics to research it, right? So this calprotectin score is now almost back to normal range. Remember, really high range is 500, but he was like double this to start out with, right? So this calprotectin score, I don't know how easy it is to, but we only gave him 2 treatments, and the calprotectin score dropped by half. And look at his thing. So anyways, it would be interesting to see going forward with these. Energy up. Why is his energy up, Sharon?
Why is his energy up? Because he's digesting his food.
And what Saam treatment did we take?
Oh, we supplemented the spleen.
And the
lung previously.
Yeah, the lung, which is so good for putting qi into the system. So energy up, no pain, bowel normal. So everything's going great with this case. What about his dance? Oh, I didn't put the dance in. At some point, he goes to the dance, and he's able to dance and not run off and go to the bathroom. He was so happy, right? He was just so happy about this. So he used that good symmetry, fixed his digestive system, and went to the dance. He was really happy. This is, again, 17-year-old male. He doesn't have much life experience, right? So this is like the day, homecoming dance, whatever it was, dance, right? So he was really happy about it. Anybody have any questions on this case?
No questions in the chat.
Great. And how about live? Okay, great. Now let's do your case, Kevin. So what we'll do is I'll bring somebody up and we'll talk about their case. Leslie and I will interview them. Do we have the jar of things? Could someone bring that up to me, please? Leslie, you're on, okay. Thank you. Okay, lucky Kate. Well, you don't have a big selection here, Kate, so I'm going to... People that really don't want to do... Did anyone miss this, or people don't want to do their case? Okay. Okay, lucky Kate is going to... Yeah. I know.
Just 2?
Yeah. Okay, Sarah, come... Sarah, can you come up and present your case to Leslie and I? Leslie, take your chair, put it here. Sarah, put your chair here, and I'll find... Oh, I got a rocking chair. No. Yeah, you're going to tell Leslie and I. Leslie and I may have some questions. Oh, bring your chair.
Take notes and put it up on, or
Yeah, that would be great. And then maybe just focus on Sarah for the camera. Case study is fine. And then she'll tell us the age and the gender, and then that will be the title of it. Okay, thanks so much for coming to the Saam discussion. Please. If you don't mind, can you tell us the age and gender of your patient? Come with me, Leslie.
He's trying to.
You go closer then, because you're going to interview her.
Okay. I'm going to switch. Go back then.
Perfect. Okay. Do you mind presenting your case, the gender and age of your patient? Oh, yes. That's great. And then when you ask questions, you lean into my microphone.
Okay.
Thanks, Dennis. Thank you. Okay, with a little bit of delay, can you tell us the gender and age of your patient you'd like to present?
Female, 70 years old.
Great. And chief complaint?
Severe, intense itching, but from like the inside of the body out.
Oh, okay. Was there a big G? Was there a disease trigger that started that?
Yeah, she diagnosed with stage 4 lung cancer and was doing chemo and the Keytruda immunotherapy.
I know that one well.
For over a year, like every 3 weeks for a year. And since then, she's gotten like a clean scan, so she's stopped the treatment. But during those treatments, she developed this intense itching, and the Western medicine treatment put her on steroids for over 6 months to try to stop the itching. It never stopped the itching, but it did help. Since then, she's
Did it drive it deeper into the body?
I think so.
From the Chinese medicine perspective?
Yeah.
Mm-hmm. Okay.
So now she's no treatments, no steroids, really bad itching.
Okay. Sounds like something the Saam system could handle. Leslie's going to ask you a couple of, can you just do the microphone to her? And then Leslie's going to ask you some follow-up questions just to kind of round out your case. Do you mind? Okay.
What's her body temperature like?
She's running more cool than she used to.
Whole body cold or hands and feet?
Whole body cold and hands and feet?
Whole body cold or just hands and feet?
Not both. She just has trouble staying warm, getting warm. And before this, she used to be like more of a yin deficient. She wasn't cold before this treatment.
Are her eyes bright?
No.
Use Shauna as a reference for bright eyes. That's a +7 there. Do you see how intense her eyes are?
Yeah. Beautiful.
Yeah. It's very attractive. Bright eyes are attractive. That's why most movie stars have bright eyes too. Yeah.
No, not bright, not like super dull.
Not Shauna level, but more normal then.
Is she symmetrical?
Is she attractive for a 70-year-old woman?
Yes.
Okay, great. We're ready to treat. Leslie, do you have any more questions?
No.
You can solicit from the supergroup. Anybody have any burning questions from the chat that she wants to ask Sarah about her case, or anybody here? Otherwise, you're all ready to diagnose. You have your 3 channels you'd like to supplement and the side and a good team name. Okay, good. Everyone, let's break into our groups. Thanks a lot, Sarah. We have a question for the chat. Hold on before you go to your group. Good. Let's sit back down. go ahead with the question from the chat. I'll repeat it. Oh,
I have a question. It's Carmela. Can I ask the question?
Yes, please.
Yes. Okay, thank you. Is the skin, the itchy area or the itching is raised? The color, if it's red,
Reminder, it's
can
inside.
you see the itching?
It's from the inside out, so usually there's not any visible rash or bumps. There have been like a few, maybe, but mostly from the inside out.
And what is the quality of the skin? It feels like dry, moist?
Dry.
Okay, dry skin. What about her bowel movement?
Regular.
Okay, no constipation, no diarrhea.
No, she gets nauseous very easily.
She gets nauseous when she's itching?
Not necessarily. It can come anytime.
Okay. What about the sleep? Is her sleep will be disturbed when is with the itching, or she can fall asleep at night?
The itching disturbs her sleep, and she finds like she'll wake up with like having scratch marks.
Okay.
Yeah, the itching makes her kind of crazy.
Carmela, great questions. It's elicited other questions because these students weren't quite ready to diagnose. They thought maybe I'm ready, but now they have some questions themselves.
So more people are having questions. This is
what I'm saying is your questions elicited more questions from the students. So thanks for those good questions. Anita has a question now.
Right.
To Sarah. Oh, you say it, and then I'm going to hand it to her.
Oh, okay. Where exactly is that itching? Like, does she have some specific area when she's scratching? Where is it like that inside body? I understand about when she scratch where?
Excellent question.
It's all over. She like her scalp gets really itchy, her chest, her arm, like it's sort of the whole body at different times. Like some areas are worse than others.
Upper body more than lower body?
Yeah.
Okay, let's break out into our groups, breakout rooms for the live streamers, and then everyone here. Have Sarah and you and Leslie gone together in a group yet? No. Okay, you guys are now. Sharon and Billy, have you been in a group yet together?
No.
You guys are now? You guys have been in a group together? Okay, you guys are in a group. You guys have been in a group together? Okay, good. You guys are in a group? Dennis and Giselle, have you guys been?
Which is possible.
Yeah. Look, you're looking at it.
Yeah.
Internal dryness.
So that's when we were talking about the stomach and lungs.
Yes. Mm-hmm.
Right. So did you guys come up with 3 channels and a good team name?
We have 2 good ones.
You guys have 3 people, you should have 4 channels.
We have we have like the idea like if
Did you guys defer to everything that Billy said? Because Billy's really hot off being in the Saam clinic. So he's really hot on the system right now.
But Billy's in the wind. I don't know. Billy's thinking wind causing itching.
I'm with Billy.
But I don't know why it couldn't be also be dry causing itching.
Could also be dry, but what's more likely? For internal itching.
I guess I'm confused as what does internal itching mean?
Wind.
No, but like when someone says I'm itching internally,
Wind.
What does that?
That means wind.
That feeling?
That means like, you can feel like surface on your body itching,
Yeah.
and you can feel like deep inside your body. I had this exact same experience itching inside my body.
Oh, okay. I guess I just don't understand what that feels.
Imagine you had itching on the surface of your body.
Yeah.
Imagine feeling that in your pancreas.
So you can't like
Feel that in your pancreas. Yeah.
super annoying.
Yeah, that's what she's clawing at herself and can't sleep.
Okay,
So we really want to help her, right?
Okay, now I understand a little better. Okay. So that's it. That's wind. That's what you were saying. Yeah, that makes sense.
Billy and I are on the same page.
Okay. So wind on the inside, internal itching.
So that's your top idea, or do you guys want to do the dryness? What's your top idea, Sharon?
What's your We did
Itching.
supplement heart. We did supplement SI, and those were our two. so
Okay.
far.
I put SI top.
We had to.
Just for me.
I would say the same. And then now we have to agree on the other two treatments.
So SI.
Because it's deep internal itching. So we have this wind deep inside the body. Do we want to consolidate that wind and keep it there? Or do we want to dynamically move it? Yeah.
And why wouldn't it be gallbladder, like up and out?
It's an internal problem.
Right, but bringing it up and out, or you don't want to.
If you catch it and push it up and out, otherwise you're going to push stuff out, right? Kevin, are we ready to take everybody out of the groups and capture their recommendations for Sarah? Okay. Everybody, let's hopefully you have your channel and your names.
Oh, SI, and then we said left. Oh, that's so good. I love that.
Shanna, what's your team name and your 3 channels, please? Are you ready, Kate? Shanna, go ahead. Oh, great. Can you pass this to Shanna?
We did talk about that.
I'm supplementing some, actually.
Well, our team name is going to be Scratch That Itch.
Ah, Shauna, what size T-shirt do you want? And is it okay to have some cat hair on? No, you
Yes.
can have anything you'd like here. Would you like a book, bumper sticker, a Acupuncture of Wandering Monks sign? Signed by the whole class. Starting with Billy, he's going to start signing that, and that's going to be coming around. The whole class is going to be signing it. Sign on the front of it. What would you like? Because that was so great.
You had me at the cat hair T-shirt.
All right.
Okay.
It's over by Kate. So as soon as we have a break, go over and Kate will help you sort through it. Again, you can get a cat hair T-shirt. I'm sorry about that. I didn't realize she was in there so good. She had a little nest going, and she clawed through the tape. It was full tape and clawed through that tape somehow, and then went inside, and then came out like this. So it was kind of cute, but it was kind of annoying too because it's black T-shirts with a lot of cat hair.
It sounds like everything else I own right now, so
Okay,
it's
good.
perfect.
This will be perfect. Okay, so go ahead. This is a great team name, and you ask for the microphone so you can get a cat hair T-shirt. Channels, please, and sides.
So we actually only have 2
We can
channels.
capture all this so you'll have it.
But our team name was so great, of course, so I'm hoping you can forgive that we only have 2 channels.
Even if you guys had a half a channel, I'd be happy with
Okay,
that team name.
great. First, we want to supplement small intestine on the right.
Great. That's what I want to do too.
Oh, good.
Make your rationale.
Well, this is a windy condition, and so we are going to
Certainly
treat it with the small intestine. And we
Can you
have
pause for a sec?
Sure.
Do you know what another good way in the Saam system dealing with wind conditions, more external? This is perfect for internal, but like common cold that's just getting started. I'm going to tell you because I haven't mentioned it yet. What's the outermost layer of the conformations?
The Taiyang.
Yes. So in the Saam system, we supplement UB if it's appropriate for early stage wind cold or wind heat. It's got to be really early stage, scratchy throat, stiff neck, just getting started, just about to come down with something, because you're going to take a big chance by flushing with cold water the surface of the body and wash it away. But if you're wrong, that makes everything worse. So you have to be, I'd say not, it's up to you, depends upon what's your clinical, like, are you timid in clinic or do you go for clinic stuff?
I'm still finding my way.
Yeah, so but consider that, I mean, that's in your back pocket. You know, patients sometimes do come in with that, like early stage, early stage, and you can just wash it away, the Taiyang, with ice cold water.
Okay, great. We also like that one just because of the information we had. She was very symmetrical at 70,
And
looked
pretty
great,
at
so
70.
that suggests a kidney excess possible. Good, nice balance. And our second choice was to supplement stomach on the right.
Great. What's your rationale?
We wanted to descend some nausea, and also maybe these headaches sort of in there. She also had dry skin on the outside,
She did, but nobody. We neglected to ask Leslie
I know.
why what her body type was like on the inside. We have no clue. Isn't that beautiful?
And what would you ask now if you had that opportunity?
What?
What you would ask that now? Could
Yeah,
we,
it
could we
would
hear
be
that?
great. Only if we had a microphone coming over here. I will ask Sarah. Sarah, what's her body type? It's dry on the outside. What's her body type inside? For at this point, as far as Shauna knows, she could be 700 pounds or 50 pounds because she never told us. So we just don't know.
She's a thin body type, but she has had some weight gain due to the steroids. So she has like a moon face, and has probably gained at least 15 pounds.
A mixed wet dry dynamic. Only if we had a system that could manage both those things. Okay. Oh, so that was your two. Okay, great. What about supergroup Billy?
The only thing I have to add is just heart.
So let's start with the top things.
The top would be assigned a right side.
What's your guys' team name?
The team name is Samsara.
Oh. Ooh, Billy. Billy, you already have a book. You have the app. What do you want, Billy? You
I'll
want
take
a
some
t-shirt?
cat hair.
You want cat hair? Go see Kate, and you can have cat hair, and there's some t-shirt involved also. Mostly cat hair, but some t-shirt involved.
Thank you.
You're welcome. Samsara. Billy, can you explain Samsara to Anita, please?
It's what we're in right now. It's the cycle of existence. The first idea that we had is just the same as before,
Perfect.
which is S on the right side. Second idea was, the second and third idea was pretty much at the same level. So the second idea is heart.
Because cold, right?
Because of the cold,
Mhm.
and then also stomach on the right. So
I
also
know,
the
but
same idea.
I think stomach, you guys got lucky, but you didn't know what she looked like. So you're lucky that she's normally thin. So in a way, you guys are lucky that she had that prednisone, right? Prednisone that made her add a little bit of dampness to her body.
Mhm.
So you guys got lucky.
A little bit of intuition, perhaps.
All right, Billy, I'll allow it because of the good team name. I'll allow the intuition getting in there.
Question about treatment on the right. If it's lung cancer and we're thinking lung is on the right, would you treat the left?
You could. I mean, we're going to want to supplement stomach on which side of the body and liver on which side of the body. Or excuse me, lung on which side of the body and liver on which side of the body. That's more of our consideration for that.
Okay, so you're only thinking if you're
When we
treating
supplement
lung.
when we supplement stomach or supplement liver, we
Okay.
consider the sides.
Okay.
Other than that, at this stage, don't worry about the sides. Besides that,
Okay.
but there is some other parts of that. But
Yeah.
it's already this is plenty for one weekend. Okay. Anybody else want to in person want to say anything about their case? Anything unusual that they have? Yes.
Dennis and I thought about supplementing the Sanjiao.
Mhm.
Also, and so I guess I'm curious about supplementing the Sanjiao versus supplementing the heart.
What's your rationale for supplementing the Sanjiao?
We talked about, I guess, the cold aspect.
Mhm.
She just has difficulty warming up, and also the bright eyes that
Did
were
she have-
not existent.
Oh yeah, so so she has
She
dull
didn't
eyes, is that
have-
right?
No, just sort of not bright, not dull.
Even, so like a 0. So
Okay.
not bright and not dull.
Okay,
Not
okay.
like Shauna's and not like. Okay, we don't have super dull eyes. Okay.
Okay, I think I had dull eyes in my head.
Okay,
from
yeah.
After the discussion,
so that's good, but so that's wrong. Anything else? Oh, she's cold, so you wanted just warm rather than hot.
Right.
I like to do that style, especially seeing a patient for the first time. So cold hands and feet, right? Especially feet or hands.
Especially feet. She has a history of stroke on the left side, so her foot.
Oh, that's an important
Her
information.
foot on the left is often more cold.
Right, that would have been a good question to ask. Any other health conditions that is going on with the patient right now? And having a previous stroke, that would have been really good. Billy, previous stroke? Wind. This condition, wind. So Billy's top idea of small intestine I really like. Okay, And again, this is pretty good. We also have a knife as a possible gift too, but
In Chinese culture, that's not true.
That's true.
Our name was Somewhere Over the Rainbow.
Somewhere Over the Rainbow. Excellent. Okay. No clapping.
I like it.
Oh my God.
All right. Since everyone clapped for that name, is that you or Dennis? Was that
Dennis.
Dennis.
All Dennis.
Do you want cat hair plus a little bit of cotton as a gift, or a book, or as a what do you want?
Sure, cat hair.
You see, Kate. There's extra small men's, and I think we may have something in there for you guys. So, good. You guys will out there discuss it because again, there's a lot of cat hair and not a lot of selection. Okay, so great. But this is the sponsor for this class. It's Single Tribe, so we gotta give them a shout out.
What were the second two choices? Sorry.
Well, our first treatment would definitely be supplementing the SI. So we wanted to start with supplementing the SI, and then our second, we were considering supplementing the Sanjiao.
Okay.
To deal with that cold, and then the eyes are even, so we don't have really good things.
Yeah, right side.
Great.
Both. And then.
Is it itching not especially on one side of her body than the other?
No.
Just upper body itching, but not a side.
Okay. And then Dennis and I also had a discussion between lung and stomach, but we did have the question about body type. Now we know, so we would supplement the stomach.
Great.
But depending on the orders, I guess.
Great. Okay, thank you. What about from the live stream, Kate? Any? Some questions. Great.
Questions from the live stream. Wanting some clarification on why the small intestine treats the wind.
It supplements blood and drives off. It moves things. It makes dynamic movement in the body. And that's a principle of Chinese medicine, is to supplement the blood to deal with wind, and then also to move it off the body. So that's the mechanism.
Great. And then for their group, what came up first was to supplement the liver.
What's the name of that group?
It's the Saam Like It Hot.
Okay, good.
Supplement the liver on the right.
Mm-hmm. Can you ask him? Can you put in the chat the rationale for supplementing the liver on the right, and then we will get to that later. But have him just say that in the chat now. I'll say it to the camera. You guys supplementing liver, make your rationale, and then go on, Kate.
Following that would be supplementing the stomach,
Mm-hmm.
and following that is supplementing the heart.
Okay, good intuition again with the stomach. And then heart, to deal with that cold. Okay, great. Anybody on the live? Was that one whole group for the?
I believe Carmela has a question.
Go ahead, Carmela.
Let me. Okay, Carmela, you can unmute.
Hi, Carmela.
I was the one who was thinking about two ones that I was in dilemma. One was the small intestine.
Carmela, yes.
And then, oh great, thank you for giving me maybe a shirt or a book or something. Sorry. And then.
Okay, no, Carmela, you got to earn this. You got to earn this. I'm happy about that. Well, Carmela, what was your group name? What was your group name, Carmela?
What is the group name, please? Kate, help me there.
Oh, I can look here.
Saam Like It Hot.
Saam Like It Hot.
Okay, all right, that was a good group name.
And I was suggesting the liver.
Carmela, what do you think I am? Made out of t-shirts?
No. I was just joking, you know.
Me too.
Joke, and so I'm joking back. Being alone in a room and trying to struggle with technology is really not fun.
Yeah. Yeah, you can tell Kevin and Kate that first 30 minutes of the class. Oh.
I want to I really like to think about the liver. I'm thinking about the liver, and I want. I'm not sure about it, but I did think if I come in Monday and I get this client, and her upper body is always itching. Yeah, it's no redness, it's not heat, but still, it's something in the upper body. She had a lot of chemo, and her skin is dry, and I feel like a little bit of cooling her and give her hair.
She's already, Carmel, she's already cold.
I know, but sometimes eating brings a lot of nervousness to the body, and you keep eating. So I think it's a.
If that theory works for you in clinic, Carmela, you're welcome to use it. But for me, it's so.
And then to supplement the blood.
What about small intestine to do that, Carmela?
All right, I was thinking about small intestine, but I'm just trying to understand why I'm thinking wrong when I'm saying liver. And I don't mind to be wrong and learn my mistakes.
I don't understand what you just said.
I said the reason I brought up the liver is because I wanted to understand where I'm thinking wrong. If I'm not right, what is wrong about my way of thinking?
Right. Truly, we have no idea who's wrong or right about this. We're just making our best guesses at this point because we want to actually treat this patient. Sarah will treat her patient, and so she'll take one of our ideas, try it, and then we'll find out who's right or wrong. It's quite possible that you have the best idea supplementing liver. It's quite possible, but I think that's unlikely. Again, we just have to do, statistics, probability. We just have to do probability of our things. And again, I told you at the very beginning, I'm never 100% certain about anything, but I'm pretty confident about this one, that small intestine will help her. And liver, because she's so cold already, is probably not a great thing based on the probabilities. But like I said...
And what do you think about upper body? How do we understand upper body itching? Night itching.
We understand that as being deep-seated itching. This is deep in the body, so it's in the organs. So that's deep. So wouldn't it be great if we had a channel organ system that was able to dredge out and move all these old things and get it out of the body, and then as it does that, make a whole bunch of blood behind it to push it all the way out? Wouldn't that be great to deal with upper body, deep-seated wind problems?
Okay, so this is the small intestine action.
That's what Billy and I think is a good idea here.
Okay, thank you.
Okay, you're welcome. Okay, yeah.
And another question came up in the chat from that conversation. What other organs or channels would we supplement to supplement the blood other than the small intestine?
Liver is the best one to supplement the blood. So that's our top idea. Liver is really good for supplementing the blood. Remember in our discussion yesterday, we talked about patients that have plenty of blood is the liver excess. They're all shielded behind all that blood. Remember that dense, cool, that's the nature of blood. So they've got tons of that nature. Small intestine supplements the blood a little. It's a distant second in the Saam system when we need to supplement the blood. But again, this is really perfect for us because the patient's already cold. So isn't it great to have a fire phase aspect? It has Taiyang cold water, but it's basically equal. So rather than putting a whole bunch of cool energy in with the liver, we're going to put fire actually in there, but that's great, and then ice cold water, so it's going to end up being neutral. So that's better than cooling someone that's already cold.
Another question is, are there any indications of kidney excess that would indicate for us supplementing the small intestine? And secondarily, are there any
Can you ask the person who asked that question, do they remember from Sarah's presentation 2 things that hinted towards the kidney excess? And then if they can't remember those 2 things, I'll repeat it for them. Okay. Anything else for the chat besides that?
Are there any contraindications for supplementing small intestine?
Yes, if there's no kidney excess, it's contraindicated.
And a follow-up question, if you can offer more information about how supplementing the small intestine can build the blood?
I think it's the fluid and fire part of it, right? So it's putting water and fire. That's a little bit, we have to use our imagination. That has blood is like water in the body, and with fire in it, red. That's how I think about it. But it's much weaker. The liver itself is more directly supplementing the blood. This is a secondary one. We have to kind of use our imagination. But definitely, from my experience, it definitely supplements the blood at least a little, small intestine.
I believe I see an answer to the question about kidney excess that we might have seen from Sarah's case. What's written here is the lung cancer as consolidation.
Could be. Anything else?
Not yet.
She's pretty and attractive for a 70-year-old woman. Okay, you guys, let's take an 8-minute break, and we will come back here and we'll do another case. Maybe we'll do one of my cases, and then Kate, again, really elicit some people that if they want to present a case from the live stream, we'll take their names, put it in a hat. You'll pick out the winner, okay? When we come back, when we come back, we'll wrap all that up and tell you everything. Okay.
All right, ready to start?
Ready.
Yep.
Shauna, since you have the microphone, everyone, welcome back. Hope you had a good break. Shauna is going to sit in on this case with me. Our first case is a 49-year-old female. Shauna, as we go through this case, no, you can sit there. As we go through this case, I know your dream come true. As we go through this case, I would like you to ask me any questions about it. You'll be representing people throughout the world on the live stream, and these people here in person. You're going to be the spokesperson for all of them. So if they have questions, they have to just kind of channel into your mind if they have questions about it, because I'm going to present the case, and then as we go through each page, Shauna, that would be your opportunity to be like, oh, what about something else that I didn't do, okay? So really, everyone, please consider this being like your own patient. So this is your own patient, 49-year-old female. Sean, if you don't mind reading about this, and then you can ask questions about it.
Sure. Her pulse is slightly thin and tight bilaterally. Her tongue is also slightly thin, slightly pale. Her face is symmetrical, with slightly dry skin and light blue eyes with sadness. Oh. And brightness?
That's body.
I know, but I'm asking you right now.
Oh yeah, for sure you can ask me that.
Okay.
Yeah, like half yours, 3 out of 10 brightness.
Okay, thank you.
And the symmetry is really good.
Really good. Okay, she's a looker.
I don't usually use that in my clinical terminology, but that's how you document that. You put that in your chart. That's fine.
Okay, her body is lean. She has dry skin.
Great. Okay. Do you have any questions for me about her pulse, tongue, face, or body? Besides the eye brightness, which I think was great. It's 3 out of 10 brightness.
Mm-hmm. It always takes me a little while to digest these things.
Yeah, but once we move past from this page, we won't come back. So
we won't come back.
No, this is like a patient, right? You can't go back and you're about to put your needles in, so you've got to digest and absorb this information, and then you can always ask patients more questions. Since the patient's not here, I'll answer for her.
Okay, but I would like to phone a friend. Leslie, do you have any questions?
No. Leslie already was on the hot seat, and she's still warm. She's still warm from being on the hot seat herself. So Leslie's off duty. That's a smart move. The senior student here that's got a lot of clinical experience. That's very smart. But she's not going to be there with you Monday morning. Is she that I know about? Okay. So anything more on this? Never to be seen again.
Just clear complexion, dry, symmetrical. She's clear. She doesn't have any redness or nothing like that. Okay. Cheeks, nothing. Okay. Go ahead. Okay, her chief complaint is a darkness.
This is her. I quoted this. This is why she's coming to see me. She feels like she has darkness.
Darkness.
I was like, whoa.
Which
go on.
You translated as hopelessness after talking to her more?
Yeah. So she. What do I say? The hopeless part.
Right after darkness.
Yes. Oh, yeah. So she feels hope. I told you her eyes look sad you know, sometimes you can look at someone and they just look sad. This is her eyes look sad to me. And yeah, the darkness, I'm saying there, yeah, she said, my chief complaint, you know, she didn't say chief, but the reason I'm coming to see you is darkness. And then we talked about it a little bit more, and then she said it's hopelessness.
Okay. Okay, great. So for 1 week before menstruation, and she's about 5 days from her menses
This is when she
now.
has this, maybe this, and I didn't word this
I
exactly
see.
perfectly. So she has this darkness, hopelessness for 1 week before her menstruation, and she's about 5 days before her menses right now.
Okay, great. She gets really low. And this has been slowly coming on for the last 2 years.
Yeah, about a week before her menses, for the last 2 years, this darkness, hopelessness comes. Otherwise, she's quite happy and everything's going great. You know, she's got a good life. She's got a great life.
Okay. Great. So she wakes almost every night around 3 a.m. for an hour, which seems like it fits. And she's microdosing herself with psilocybin for the past year, which decreases the darkness just a little bit.
You have any questions about this page?
There's more, right? No, I don't. She has occasional night sweats and a history of benign breast lumps. I have to write things down.
Yeah. For me, I try in my clinic. I went to see a doctor, and they had a big computer, like old school computer, and like this, right between us, and he was just like, and I was like, oh my God, this is horrible. It felt so horrible. So now I don't even write anymore. I just go in and just sit with the patient. It just feels, I think writing is really, I miss so much stuff because I don't write it, you know, so I feel like that's a sacrifice for just sitting in the room with the patient.
Yeah, and I hope to get to your ability right now.
I miss tons of things because I don't write it down immediately.
All right. And do we have more after this?
I'm not sure. I forgot. But what about, this is a theoretically Sanjo access, and sometimes your memory's not great. I can't remember exactly what I did with this case. I remember who it is now, but I'm not sure how much more information. So maybe before we go to the next page, is there anything else you'd like to know about this patient before you're ready to diagnose and treat? Remember, you're going to decide a team name, 3 channels, the side you're going to put them on. Are you ready to, based on the information I've given you so far, to be able to do that?
I know that questions will come up, but I don't have them yet.
Okay, but this is important to ask them before you put the needles in, because basically what I'm saying now, as soon as we get to there's going to be some kind of picture. As soon as we get to the picture, that means you're putting your needles in, so you can't ask any more questions.
I'm curious about her menses.
Let me check in with Leslie. Is that too harsh, or should I have some more questions?
I actually have a question.
No.
I have no question. My mind has suddenly gone blank.
Okay, thank you.
That's fine.
Such a good student. Good.
I've only been at this a little more than a year. So this is how good
Am I being yeah? Kevin said my teaching style. I was like, what? Oh yeah, I guess it's a teaching style. Okay, is that too harsh what I'm doing to Shanna, or should I make it as this is my instinct, is to make it as clinic as possible?
Yes.
Okay, Shanna,
We're
we're going to make
on
this.
Monday. That's
you're
tomorrow.
going to just a few hours from now. You're not going to have anybody. You're not going to be able to pause. You're going to have to open your needle packages and start putting some needles in. So that's what I'm trying to simulate that right now.
And I understand.
But it's even better than that, because look, you have a super group that's going to help you with everything. So you're just going to try and come up with your own diagnosis as best you can. Plus, I'm going to pair you with somebody. I mean, it's much better. So, but this is your ability to, just to add more pressure.
Hi, everybody.
Say hi to Austria. Somebody in Austria. And other places too. Sorry, I forgot exactly where everyone's from, but definitely Austria. Okay, so I'm not sure how much should we look, and then we'll give you some more things. Maybe I could prompt you about stuff.
That would be wonderful.
Okay, so yes. Nothing from the chat. Shauna's doing all the questions.
Oh.
There's nothing else in this.
Okay, yeah, so she's representing everybody, so we're basing everything on her to give her a clinical hot seat. Yeah, no problem. She's in the clinical hot seat, and she's got the responsibility for the entire class. And the recording, this will be, as long as there's internet, this recording will be available.
Forever. I don't think your teaching style is too harsh. You are just also asking a student who doesn't have a lot of experience yet.
But you're going to go to clinic. This student's going to go to clinic tomorrow, so I want to simulate that. Any errors, something you forgot. This is. Can I tell you about my teacher, Dr. Wu? I told this story to Billy.
Yes, please.
Okay. My teacher, Dr. Wu, she loved to put students on the hot seat, and I spent 25 years ago, I was in her clinic, and I still remember like it was yesterday certain things. Hey, no, Anita, no prompting. So Shauna, and when I was in school, I went to ACTCM. In the morning, I would learn textbook medicine, and then in the afternoon, Dr. Wu would let us ask questions, and then she would. I know how to practice because of my teacher, Dr. Wu. School, it doesn't know anything. So, anyways, in the morning we did single herbs. I studied Wu Wei Zi, and I was really impressed. Wow, it's got 5 flavors and it's so great and everything like that. So, I studied Wu Wei Zi in the morning. In the afternoon, I came to see my teacher, Dr. Wu. And I said, Dr. Wu, is Wu Wei Zi a good herb? Do you know what she was towards me, Shauna? Furious. She said, for who? When? And she turned on her heel and walked away. And so for me, I went, I remember, like this is 25 years ago, I remember that because I was so mortified. My teacher yelled at me and I was super uncomfortable. This is how you learn. When you're you have to have some kind of emotional thing to be able to attach information to. So if you're really uncomfortable, you remember forever. So how you're uncomfortable right now, my heart goes out to you. I really feel, that's what I've been doing. I have strong empathy. I've just been doing that. I've been so uncomfortable coming up to this and the whole time. But I will remember this class forever, and I want you to remember this interview forever. So that's why I wanted to do that, because Dr. Wu actually oriented me to Chinese medicine. We can never say a herb is good or bad. We always have to have the diagnosis and the climatic factors and the seasonal factors. We have to do that. Otherwise, we can't say what's good or bad. We have no idea. Okay, so all that said, the heat is going up on your seat because we may have more information, we may not. Do you have any more questions for me?
You were going to prompt me.
Yes. What about, do you want to palpate her abdomen and see if her body has to say anything?
Yes, I would love to do that.
Isn't that great? That's what I like to do when I'm not sure what's going on. I like to ask the body. So you ask me something and I'll give you the answer for her body.
Okay, so let's just look at her midline,
Mm-hmm.
please, and tell me what temperature that is.
It's pretty normal and not especially tight or soft.
Okay. And then if you were to palpate underneath her ribs on either side, anything there, any tightness?
Nothing special, both
Nothing
sides.
special, okay. Got it. Okay, I'm curious about her temperature at her extremities.
Great. Her feet are warm.
Okay. All right.
Great.
Well, that sort of falls in line already with an idea, right, that we have.
I'm not sure what your idea is, but don't say it.
Okay. All right. So you're asking the body. That's a great way to get
Yeah,
started.
but that's when I like kind of run out of questions. I like to do things, and then I just ask patients stuff. Right, my interviewing style is. I did a whole talk on this for geological. Right, it's kind of like asking about things and things like this. I feel like when I go into the room and I sit with the patient, they'll tell me what's wrong with them. The body will tell me directly, or their mouth will. I just trust that, and so I just kind of get some space, and do it. So this is so artificial, right? I just have a slide here, so you can't really give it space. But I try to prompt them with things. I'll feel their body and be like, "Oh, these feet are really warm." And she will say to you, "Oh yeah, everyone always complains. All my girlfriends complain about their feet being cold, but my feet are always warm." So then, that's a nice piece of information for us. And then that will lead to something else, and eventually they'll just tell me what I should do with Saam. And then, don't answer, but her chief complaint told us what to do with Saam, right?
Kind of.
Okay, but don't answer why. Okay. But yeah, she clearly told us what she wants.
So, I mean, my brain immediately goes to asking questions that confirm that potential, but really I kind of want it, my goal would be to rule out some other options.
Yeah, because now you've already got your top channel, if you and I are thinking the same thing.
Okay.
And so now that you have your top channel, then what do you want to do? You know, what are your other channels? That's what I like to do. So I've got my top channel. I feel like I'll sometimes, you know, poke at that a little bit, but especially if I don't have a good 2 or 3, then I'd rather spend my time poking that. Do you have any idea about your 2 channel, but don't tell me what it is?
Yeah, no, I don't yet.
Okay.
Maybe.
Let's find a second channel for you.
Let's look
at her body again. Shauna, let's work together and look at her body again.
Okay.
Don't tell me what it is, but doesn't that body tell us something in Saam?
Yeah, it
does. Is that different from your top idea?
Yes.
Okay, good. So now we have a second idea.
I think I maybe also have a third, I don't know. Okay, so...
what about, let's discuss this, psilocybin microdose. Does that mean anything to you in Chinese medicine?
No.
Not to me either,
Yeah,
right? So that just, I leave that off. What about this waking almost every night around 3 a.m. for an hour? Don't tell me why, but does that say anything to you? Okay, good. So do you have a third idea yet?
Yeah, possibly.
Okay, so you got 3 ideas?
I do.
Okay, let's see if we have any more information. We got to this, right?
We did.
Does that say anything to you too? The night sweats in the... Don't tell me what it tells you, but I'm just asking, does it tell you something? Okay. Yeah, we ran out of information.
Okay.
Okay, but we did generate 3 ideas, and you did ask me about her feet, so I'm
okay, I got one in there. Phew, okay.
Well, yeah, this is maybe worse than clinic, because if you forget ideas, then only one patient knows, but now everyone knows on the internet. So there's a lot of pressure. But anyways, so I'm extremely pleased about that, because we got to our things. So let's break up into groups, and I'll assign everybody here to go into groups, and we'll work on this. Again, we're just trying to speed up a little bit, so that's why we had just one person ask questions. Other time, we'll have questions will be open for everybody. Okay, Dennis, have you worked with Sharon yet? Can you come up here, please, and do that? Shanna, have you worked with any front row people? No, I haven't. Okay, can you come up and work with Leslie? Anita, with Billy. Did you go with Billy already?
I did.
You did? Okay, great.
Ready for lunch.
Ready. Okay, welcome back everyone. I hope you had a really good discussion. Now it's time for our 1-hour break for lunch. Wherever you're at, I hope you enjoy your 1-hour break. Here we're going to have the sun's came out, and it's really pleasant and warm here, so we're going to really enjoy our lunch. I'll see you in an hour from now. Everyone have a good break.